Good afternoon, everyone. Good afternoon, everyone. My name is Councilman Kiana Johnson. This is a hearing. This hearing is called to order. This is the inaugural public hearing of the City Council Special Committee on Gun Violence Prevention. The purpose of this public hearing is to hear testimony on Resolution 170609. I would like to recognize a quorum of committee members with my co-chair members, Mr. Michael Dobard. Also, so this happens when you have two Tylers. Mr. Darrell O'Connor. I also like to acknowledge the presence of the chairperson, who's also a member of Public Safety, Councilman Curtis Jones Jr., and I also like to thank all of our subcommittee chairpersons who are also here in attendance. In September, I introduced on behalf of a young lady who runs an organization by the name of Mothers in Charge, Ms. Dorothy Johnson Spike. We passed unanimously a resolution in the City Council recognizing gun violence as a public health crisis here in the city of Philadelphia. It's not news to anyone here that gun violence is a fact of everyday life in Philadelphia. Gun violence devastates not only victims, but also their families and their communities. The costs are enormous. Fortunately, the public health sector has been a leader in developing evidence-based approaches to gun violence, and Philadelphia is fortunate to be home to leaders in this area. For that reason, we chose public health as one of our first hearings on the Special Committee on Gun Violence Prevention. For me, my passion in this particular issue just stems from being an advocate around the issue of gun violence starting back in 1998, where I watched a cousin of mine and several of my friends murdered in the streets of South Philadelphia. And so with the formation of this committee, our primary role was to come up with a comprehensive strategy, but most importantly, action agenda, particularly working in partnership with the Mayor's Office of Violence Prevention, Michael Dobard, the Managing Director here in the City of Philadelphia, to find ways for us to significantly reduce the issue of youth gun violence here in the City of Philadelphia. And one of those key areas is looking at the areas of public health. When we talk about the issue of gun violence, we talk about behavioral health issues, we talk about post-traumatic stress that some of our young people may face, because when you look at the level of gun violence that we see going on in the city right now, there are young people who are in the crosshairs of the shootings and the murders. About 2 weeks ago, I was at a school at Tilden Middle School. I was up there for a Thanksgiving Day holiday celebration, and I went inside one of the classrooms with one of the teachers that I knew to talk to some of the children in the class. And I always go into a classroom and I ask one or two questions. And one of the questions is, how many young people in this room have saw someone who has either been shot and or murdered? And this is a middle school classroom, and you have more than 95% of the children in the classroom raising their hands. And the next question I would ask the young people is, how did that make you feel? And you get a variety of different answers, and honest and brutal answers from some of the young people. Some people felt sad, some people felt angry, some people wanted revenge. And so that's a psychological aspect that gun violence has on some of our young people in terms of how they respond and go about living their everyday lives. And so it's very imperative that as we look at this comprehensive issue of youth gun violence, we do not pay attention to how it's a health epidemic here in the city of Philadelphia. Also today, on a state level, the chairman of the Pennsylvania Legislative Black Caucus, State Representative Jordan Harris, he also just sent out a statement on behalf of the Black Caucus acknowledging gun violence here in the state of Pennsylvania as a public health epidemic. And so I'm going to ask for my two co-chairs to offer brief remarks, and then I'm also offer an opportunity for the chairman of public safety to say a few remarks, and then we're going to call up the panel to get started. And again, we know we will not resolve the issue of gun violence overnight, but we set this committee up for the long haul to find out how can we again be aggressive in our strategy, and most importantly intentional and how we allocate resources in addressing this issue. But regardless of who's on the second floor, we will always make sure that this is the #1 priority here in the city of Philadelphia. I'm never shy to say that we have a task force on the opioid crisis. We have a task force on something called Vision Zero, which provides open streets and bike lanes. We have a task force on the historical preservation of buildings, and I support all of those initiatives. But saving the saving of young lives should also be the #1 priority here in the city of Philadelphia. So I want to thank the mayor for stepping up and creating the Office of Violence Prevention, and also the managing director who said, listen, Councilman, I want to be all over this. From day one, he came in my office and said, let me know what I need to do so we can roll up our sleeves to get to the bottom of this, because we'll only be a great city if we're a safe city, and that depends on how safe our young people are. So with that being said, I'm going to ask for my co-chair, former member of the Alcohol, Tobacco, and Firearms, a civilian today, Mr. Darrell O'Connor, to please say some brief remarks.
Thank you very much for Councilman Johnson and Councilman Jones for letting me participate in this very important project. Again, I want to thank all the committee chairs and all the committee members that have been participating. This is a comprehensive effort. For those who have been involved in the gun violence issue, many of you have over many, many years have seen that the problem is very deep, and it does require a very comprehensive effort. And the way I like to see, of course, I'm very heavily from the enforcement side, but I do believe that it's very important that we get into the community and the cultural side, and try to break the culture of wanting young people, or for all people actually, to resort to gun violence to resolve their issues. So with that said, I thank you again for letting me participate, and I look forward to hearing all the testimony today.
Michael DeBardinas, Mr. Chairman.
Thank you, Councilman. And first, I want to thank you and Councilman Jones for your leadership around this important question. And more importantly, or just as important as your leadership, is the understanding of the complexity of the question and the need to create forums and structure that would allow all the different elements that are, all the different city agencies and departments that focus on this question of violence and law enforcement and community engagement, to bring us together in a forum that I think has the possibility of great progress and a great positive impact. So I'm again pleased to be here, and I know I speak for the mayor and all the folks in the managing director's office, leadership in the managing director's office, that we are committed to working with you in this committee to make a serious effort to reduce the incidence of gun violence in the city. Thank you.
Councilman Curtis Joe, Mr. Chairman.
Just wanted to take a moment to commend Councilman Johnson for focusing this effort. When he first came on board, he had me in the caucus room right across the hall, and there might have been 50 young men that he brought together, and he just simply asked the question, why are you putting yourself at risk? Why are you taking to the gun? And I'm gonna be honest with you, the answers to those questions scared me. And I'm from a real neighborhood. And so he has since then been focused like a laser beam on this issue. Anytime the Hospital Temple has to have a trauma unit that trains the military on how to deal with gunshots, that is not a distinction as a city we really want to have. And anytime when you look at the fact that they're now teaching our young people how to save someone's life that might be shot by that same gun, that's not the kind of thing that we should be teaching our young people. This new normal is unacceptable. So I'm looking forward to working with the committee here and looking forward to, more importantly, coming up with some solutions. Like, you know, we can do group all day, but we have to come away with action steps that reduce the gun violence in the right direction. So I thank you again, Mr. Chairman.
Thank you. I want to make note just of a couple things before the clerk reads the title of the bill when we call up our panel members. Separate from this particular subcommittee, and the subcommittee chairman for this particular hearing is Dr. Joe Fine of CHOP, and also we have the Phil DeMera, who's the head of the Department of Behavioral Health. But we also have a Victims of Gun Violence subcommittee. We also have a subcommittee on community outreach, a subcommittee on program review that's also headed up by Mr. Shondell, and a subcommittee on social services, and one subcommittee on illegal guns. Just want to acknowledge the presence of some of our other members who are also here. We have Mr. Joel Fine, Ms. Alita Garcia, Ms. Dorothy Johnson Spite, Mr. Anthony Murthy, Caroline Keating McGlynn, Mr. Charles Hoyt, Mr. Rob Reed, Ms. Julie Wertheimer, and obviously we have Mr. Michael DeBardinas. Can the clerk please read the title of the bill?
Authorizing the creation of a special committee on gun violence prevention to address Philadelphia's enduring plague of gun violence by facilitating coordination among stakeholders and formulating a comprehensive gun violence prevention strategy.
So can the clerk please call the first panel?
Thomas Farley and Ruth Avaya.
How you doing? Can you please state your name for the record?
Committee on Gun Violence Prevention. Is the mic working?
Yes.
I'm Dr. Thomas Farley, the Health Commissioner for the City of Philadelphia. I'm here to testify regarding Resolution Number 170609, which authorizes hearings to examine the plague of gun violence by facilitating coordination among stakeholders and formulating a comprehensive gun violence prevention strategy. I'm very pleased that you are taking a public health approach to gun violence. According to the city's medical examiner, 247 people died from firearm homicides in Philadelphia in 2016. That number is nearly 5 deaths every week. But even that is just a small part of the firearm problem. In 2016, 1,100 people in Philadelphia were treated in hospitals for firearm injuries, for more than 4 non-fatal injuries for every fatality. In the same year, 54 people in Philadelphia died of firearm suicides. Firearm violence also creates emotional trauma for shooting victims' family, friends, and neighbors. In Philadelphia, 1 in 4 white adults and 1 in 2 black adults witness violence while growing up. Stressors like these make children more likely to suffer from mental and physical health problems when they reach adulthood. In Philadelphia, firearm victims are overwhelmingly young adult African American and Hispanic males. For example, the rate of firearm death was almost 15 times higher among non-Hispanic blacks than among non-Hispanic whites. Firearm homicide is the leading cause of death among African American men 15 to 34 years of age, accounting for 60% of the deaths in this age group. Most of our efforts on gun violence in the United States have focused on catching and incarcerating perpetrators. As necessary as that is, it happens after a shooting has taken place, so we shouldn't expect it to have much of an impact on reducing the number of shootings. Taking a public health approach means trying to prevent shootings. That work involves identifying the underlying contributing causes and then reducing their impact. This approach can be very successful. For example, in the 1960s, this country began to take a public health approach to reducing deaths from car crashes by designing and mandating safer cars and safer highways. Even though Americans steadily drove more, from 1970 to 2015, deaths from car crashes per capita fell 60%. Fortunately, there are many efforts already taking place in Philadelphia by the police department, other city agencies, and nonprofit organizations that do take a public health approach. A public health approach to gun violence tries to prevent fatal shootings by focusing on a combination of 3 contributors: the people who shoot, the guns themselves, and the environments in which shootings take place. First, we can engage with high-risk people and encourage them to reconsider shooting as a solution to conflict. The ceasefire, or cure violence model, operating in North Philadelphia, works to interrupt violent retaliation, treat the highest risk individuals, and mobilize the community to prevent violence. The focused deterrence model, operating in South Philadelphia, also engages with people who are likely to shoot. by encouraging them to accept social services and give up violence or experience a forceful crackdown by law enforcement. Prevention models that try to redirect potential shooters in other ways have also been successfully tested. In Chicago, a summer part-time jobs program cut violent crime arrests among high school students by 43%. In the last few months, my department has worked with other city agencies on a pilot media campaign designed to encourage potential shooters to think twice before pulling the trigger. The evaluation of this project has not been completed, but if it looks favorable, this sort of campaign could be used in conjunction with other programs citywide. Second, we can focus on guns. Studies have consistently shown that where there are more guns, there are more gun homicides and more gun suicides. Since 90% of the guns used in crime are handguns, those should be our primary concern. Our single biggest obstacle to reducing gun violence is that federal and state laws preempt the authority of the City of Philadelphia to regulate the design and sale of guns. However, by getting a better understanding of the trafficking of guns, we may be able to reduce the flow of illegal guns into the city. We could also attempt to reduce the number of guns that are stolen and then used in violence. Finally, we can make changes to the physical environment in which shootings occur. These changes can be small, such as installing additional lighting in high crime areas or removing abandoned buildings. In one study conducted by the University of Pennsylvania, remediation of abandoned homes and vacant lots was associated with significant decreases in firearm violence. The Department of Licenses and Inspections is now expanding its efforts on blighted buildings. Firearm violence is an ongoing tragedy, particularly for young African American men. Like you, I don't think we should accept this violence as a normal and inevitable. If we take a public health approach to this problem, experience says that over time, we can make real progress and save lives. I'd be happy to answer any questions.
So my name is Ruth Avaya. I'm a pediatric emergency medicine physician at the Children's Hospital of Philadelphia. I'm also a fellow. Closer. Can you hear me? Is that better? I'm also a fellow at the Violence Prevention Initiative, also at CHOP. So I greatly appreciate the opportunity to speak to you on behalf of my fellow pediatricians, as well as on behalf of my colleagues at the VPI at CHOP, to speak on the importance of gun violence prevention as a public health issue, which is amenable to the tools and methods of violence prevention or of prevention that have made such a difference in so many other areas of child health. I'm also in agreement with my colleague and with those I'm sure who are about to speak that there's an urgency to action here. Gun violence unsettles our consciousness time and time again, and it's imperative that we bring our knowledge and our commitment and our obligation to the children we serve to bear as we confront the challenge. First, let's define the challenge that we face. So each day in the country, 7 children die from firearm violence. The trauma centers at Penn at CHOP saw about 1,800 children who were victims of firearm violence between 2007 and 2016, which amounts to about 15 patients per month. Children come in contact with firearms in a number of the contexts where they work and play, including in the home, where about 1/3 of homes with kids are also homes with guns. The principles of public health have successfully faced many issues, such as my colleague noted, car crash fatalities, sudden infant death syndrome, vaccine-preventable diseases, and tobacco use in children. Public health approaches prevention from 3 angles. So there's primary prevention, secondary prevention, and tertiary prevention. Primary prevention methods are employed universally before diseases or disasters take place. Secondary prevention efforts are applied selectively in order to slow progression once a person or neighborhood at risk has been identified. And tertiary prevention is indicated once a problem is already in full force. The most effective public health initiatives are comprehensive and begin with citizen engagement and focus on safer communities overall. The approach to violence, particularly gun violence, could be as successful as our approaches to the other diseases we just discussed if we stop seeing it as a political or criminal justice issue in isolation. However, we can't pretend that firearm violence exists in a vacuum. Access to quality education, access to job training, mental health services are key components of violence prevention, and specifically primary prevention. Other primary prevention efforts applied across the board include policy and legislation. For example, background checks are currently nationally supported by a majority of gun owners, but are only mandatory with federally licensed dealers, which accounts for only 40% of gun sales. These have to be universal to be effective. In addition, collaboration with gun dealers to help enforce existing laws can be good for their businesses and good for our neighborhoods. These are measures we can support before tragedy hits the children that we serve. Demonizing groups of people is not a rational or successful approach. The only true enemy has to be the problem we're trying to solve. Guns are a part of our society with over 350 million in the nation, so we have to employ our knowledge of child development to inform our efforts at secondary prevention. For example, we know that approximately 1 in 3 handguns are kept unlocked and loaded, and many parents are alarmed to discover that in at least one study, 75% of first and second graders know where the gun is in the home, in direct contradiction to the family's perception. There are many safety mechanisms that are proven, such as trigger locks and lock boxes, and there are new technologies on the horizon that hold promise to greater increase the safety of firearms in homes with vulnerable children, such as personalized electronic safety devices and smart gun technologies. These have been shown in at least one study to have the potential to prevent up to 37% of unintentional injuries, and they're supported by the public at large. These are initiatives that can be effective in reducing unintentional injury as well as suicide. Despite our best efforts, children are exposed to the trauma of gun violence in their homes and in their schools and in their neighborhoods. This trauma, as we know, can be intergenerational and can cause kids to grow up seeing violence as an answer rather than a problem. What can our hospitals and medical centers do to lead by example? First, we can practice trauma-informed care to mitigate the far-reaching effects of violence both on victims and on their families, as well as on all of those that bear witness to this violence. Secondary prevention efforts such as identifying and addressing bullying in the schools, domestic violence in homes, can help children find sanctuary. Research also supports the notion that violence begets more violence. So coming to an emergency department for an assault injury means that you are at a 40% increased risk of gun or firearm-related injury in the subsequent future. Our own research, interviewing teenagers about firearm access, reveals that children see guns as threats to their safety, only worth the risk when the environment they face seems overwhelming or frightening. There's nothing more compelling that I can tell you than the stories of the patients that we work with, and one of the most compelling of those is a young man from North Philadelphia who was robbed of money that he had worked all summer to make so he could have spending money during the school year. And after that happened, he found a friend who was able to get him a gun, went to a local park, and decided he was going to test the gun on a nearby tree. And when he saw the destruction that firearm was able to actually effect on that tree, he was terrified, and he threw the gun away. But then he found himself between a rock and a hard place. How does he navigate his environment? How does he find a safe way to go forward if the solutions that he sees as being available to him are just as dangerous as the problem? So our job is to give that young man more tools. Tertiary prevention programs that work with young people in the aftermath of injury are growing in number and are growing in sophistication, and those continue to build strong evidence for their own success, and these are an important investment that we need to make in the process of firearm violence prevention and in breaking the cycle of violence. As pediatricians, our work is with those who have most of their lives ahead of them. To usher them into adulthood with healthy bodies and healthy minds, equipped to face the challenges of their society, is our primary objective. Gun violence, like any disease, is amenable to the principles of public health that we've been discussing today and can be approached with the same tools of prevention that have changed the lives of so many children. Thank you.
Dr. Farley, well, first and foremost, thank both of you for your testimony. So I had a couple questions I wanted to start off the panel discussion on. One is particularly the media campaign component. Can you elaborate on the media campaign the pilot program that you started? Any evidence-based leadership around the impact of that messaging campaign as relates to the reduction of youth gun violence? And you also have a door-to-door program where young people are out in the street working to reduce youth gun violence from the perspective of a public health standpoint. Can you elaborate on that, please?
Yeah, so the people in public health and our agency and other agencies have used media campaigns to try to change a variety of different behaviors, like smoking. And there's evidence that those work. They haven't used media messaging so much to try to change the behavior of shooting. And so we thought, well, this is such a big problem, let's give it a try. And so we worked with advertising agencies that did a variety of focus groups to test out different messages that might have an impact on high-risk youth that were potential shooters. And out of that developed messages, as you see up on the screen right now, of you shoot, now what? It's a message that it's phrased as a question. It doesn't preach, it doesn't say what not to do, but it does introduce a question and a bit of doubt into people's minds about what happens after a shooting takes place. Most of us learn about shooting through movies and television, and there, somebody shoots somebody else, the person who's shot drops to the ground, scene over. Life isn't like that. After someone is shot, there's a lot of consequences which everyone has to deal with, including the shooter. And this introduces some of those consequences in people's minds to think that maybe they would think twice about shooting. We don't know whether this campaign would work or not, but we thought it was worth a pilot to test it out. So the campaign is being distributed both through the mass media in the form of billboards, but also through distribution at the street level in neighborhoods, where we have hired people who are themselves high-risk young men. And they have it on door hangers, and they go into barbershops and pass out cards, and just try to get it out there sort of organically at the community level. That's been going on. I guess the distribution has stopped. We're now in the process of doing a survey to try to evaluate its immediate impact. And so we'll see. But if the evaluation looks good, it's something that could be used, I think, in conjunction with some of these other messages or other programs to try to get the highest risk people to just think twice and reduce shooting somewhat.
Okay. All right. Chairman Jones.
Thank you very much, and again, thank you for doing this. Doctors, thank you for coming. I had an opportunity to hear a presentation done by a neurologist out at Jefferson who talked about a thing called brain mapping and what happens when traumatic events happen to people and how, these synapses and trust me, I'm gonna keep it very plain speak, shut off different pathways and things like that when things happen. That's why sometimes we forget what happened at a traumatic event and things like that. But it also gives us coping mechanisms that aren't always positive about how to deal with post-traumatic stress symptoms. Can you explain what that means? Since we're treating this as a disease, and we're looking at the science of this, please tell me what happens to a kid who is, I understand a brain isn't fully formed until you're 24. What happens in your teens when you see this kind of ongoing violence? Does it change you? And as important, can we change them back?
I'm going to give a short answer, then I'm going to turn over to Dr. Abaya. I suspect knows more about this than me, but to say witnessing violence is part of a larger pattern of what people are calling adverse childhood experiences, which has been well shown to be an increased risk for mental illness as well as physical illness lifelong. So yes, indeed, there is a permanent damage that is to children who are exposed to this amount of violence. Now, the degree to which we can intervene and affect a change to that potential permanent damage, I'm not clear, but there absolutely is damage, and that probably helps perpetuate some of the cycle.
Yeah, I completely agree. So I'm not an expert specifically in brain mapping, but there are absolutely theories of learned behavior. And children are a very unique subset because, as you say, their responses or their methods of responding to things are not fully formed. ACEs, or adverse childhood events, have been, or adverse childhood experiences rather, have been well studied. And what you said is, I think, most compelling. It's not just its effect on their mental health, it's their effect on their health overall. So things like hypertension, things like their risk of substance abuse, et cetera, are affected by their exposure to things like violence. So there is a definite interconnectedness to the way that children develop.
So there's a physical manifestation of problems, health problems, that we get based on traumatic acts.
Right, so due to traumatic experiences, there are both physical and emotional kind of downstream effects and manifestations. In regards to your question as to whether or not there's anything we can do, I think the answer to that is we certainly hope so, and there's good evidence that the answer is yes. So intervening primarily before children are exposed is of the utmost importance because obviously at that point those associations have not yet been formed. After the fact, when children have been exposed to those traumatic experiences, we still believe that there are things that we can do to redesign their approach or their response to trauma. And so that's why, for example, the Violence Prevention Initiative intervenes with assault-injured youth before they're firearm assault injured youth to talk to them about different methods of approaching the violence that they confront in their communities. it's very important that more research is done as to how we can kind of rewire, so to speak, children's responses and approaches to traumatic experiences. But there's good evidence that there's something we can do, and the sooner we take action in their kind of violence journey, in their exposure to violence, the more effective we can be.
So, in the metaphor used by our chairman and others, if we're treating this as a disease, is it contagious? I mean, and my common sense, I have an answer, but I want to hear medically.
Yeah, my answer would be yes. So violence is almost certainly contagious. There's some interesting work looking at the mapping of violent behavior in communities and in environments. I think that that evidence certainly suggests that there's a contagion. There's definitely some communicability to this problem, and that is why this safe community approach, the idea that we would get down to the nitty-gritty, down to the lights on the streets, down to the job training and all of those types of effects that don't seem directly related to violence intervention or to violence prevention, but definitely have an effect, those have to be part of the solution. Because if we're going to interrupt that communicability, we have to think about it the way we think about anything else, the way we think about vaccines and any other kind of public health conundrum that we face medically.
So my final point, Mr. Chairman, is do we become desensitized to acts of violence? And in some communities, in my district even, if something traumatic happened, if a dog walking across the street gets hit, I mean, there is just such a reaction to it that, you know, oh my God, loss of life. But in certain neighborhoods, you know, the Teddy Bear Memorial don't mean a thing. It's like you become hardened by it. And how do we deal with that?
I do think that there is an acceptability to violence in certain communities, either by the people in those communities or even people outside of those communities who just come to expect that we have to choose to reject. I think that whether or not we become sensitized is in part a choice that each of us makes, but it's also, I think, the responsibility of those advocating for this cause to not allow desensitization to occur. So how do we do that? I think that there are methods of kind of using mass media to our benefit, but I think that we can't do this without engaging citizens, because there are people who live this reality whose stories, in my mind, are the most compelling. And without those voices, desensitization is something that is hard to confront. So I think using the voices of those who are exposed to keep the issue alive, to keep it in public consciousness, I think is going to be an important part of avoiding desensitization.
Thank you, Mr. Chairman.
If I could just add briefly, if a virus came to Philadelphia and suddenly killed 250 young people, we would all see this as an absolute crisis, and we would be responding as if it was a crisis. The fact that it's killing that many people, gun violence killing that many people every year, makes us tend to accept it, when in fact it should make it seem even worse. We should see it as a crisis and respond in that way.
Well, we are in a crisis. Chairman Dobard.
Yes, thank you. Dr. Abaya, in your testimony, you talked about the tertiary prevention programs that are building an evidence-based model of success. Could you just talk a little bit more about the elements of those programs?
Absolutely. So what I was referring to is when children who, absolutely, oh yeah. Thank you. Can you hear me now? Is this better? So when children present to, in my particular environment, that would be the emergency department, with an assault injury, they're immediately referred to a program that loops them into a very comprehensive kind of group of young people. So they're young mentors, they're physicians, they're social workers, all involved in helping that young person process the effects of the violence that they were exposed to, helping them reframe that violence, think about other ways to confront their environment that would not include retaliation, especially violent retaliation. So it's very comprehensive, and it begins in the emergency department. So the practical methods of that, or the practical kind of manifestation of that, is that our social workers are immediately brought in, and those patients are referred to this network, the Violence Intervention Program, the VIP. And the result of that is that they get brought into this community, and they are longitudinally involved in this community. It's not a one-time thing. And the goal of that is to help them become advocates for themselves, and then eventually for other young people like themselves.
Are there any other hospitals or emergency rooms using this model that you know of in the city?
So I'm not aware of other pediatric hospitals using this exact model. There are other hospitals that have either social work referrals or methods of kind of helping deal with the mental health effects of violence in the emergency department. But this particular program, as far as I'm aware, is pretty unique to the Violence Prevention Initiative.
Thank you.
Any other questions from members of the panel? No? All right, thank you. And I just want to elaborate on it. I think Councilman Jones asked like a very, very serious and important question. I kind of first thought about it like, okay, we already know the answer to it, but is violence contagious, right? And I think about the environment in which I grew up in and how people operate, and you will have young people that will get involved in a life of violence, particularly with guns, just based upon the association of people who they're hanging around and the allure of actually carrying a gun. I mean, committing your first act and then the so-called attention that you receive from that act. And I think our clearance rate was brought to my attention right now. Homicide clearance rate is somewhere around 37%. And so that's reflective of people not actually going to jail for committing the homicides. And so as a result, if an individual isn't caught after you commit that first shooting or that first homicide, then you start having that constant cycle, because I'm not being caught, but also the allure of carrying the gun and committing the act, and you're going to get attention from it, because in most neighborhoods you get a so-called, reputation depending on who you shot at or what type of act that you're involved in, and it becomes a cycle, and it kind of spread, as Councilman Curtis Jones just mentioned. But we're always thinking about different ways to try to cut off their head, that ringleader or that other individual who might just be hanging around the so-called tough guys, and getting them involved in something that's positive so they don't go down that same path. But when you think about the gun violence being contagious and thinking about it as a disease, that's just one of the things that come to my mind from my experience and interacting with some of the young people that I know that still, be quite frank with you, kind of live that lifestyle. But thank you for your testimony and taking time out of your schedule and being here. Can the clerk please call the next panel, please?
Katerina Roman.
Chair is very low. My name is Katerina Roman, and I'm an associate professor in the Department of Criminal Justice at Temple University. In my testimony today, I draw on 30 years as a researcher and evaluator, studying community violence and evaluating promising neighborhood-based gun violence reduction programs, not just in Philadelphia, but around the country. I want to thank the Special Committee on Gun Violence Prevention for your leadership in seeking evidence-based solutions to the crisis of gun violence. Treating gun violence as a public health problem signifies an approach where violence is preventable. Efforts to prevent gun violence begin by characterizing the scope of the problem and assessing the potential risk and protective factors. The public health framework directs prevention and intervention at the population or community level. And this is something we have not yet talked about. This is an issue that we can't just focus on at the individual level. We must think about the entire community. In addressing the risk factors and behaviors, we need to think about the whole community. I just said that. Efforts targeted to the individual are only likely to be effective when they're done in concert with social norms. For instance, it's not simply sufficient to have a program that looks at repeat victimization or re-injury. Communities need to think comprehensively, as Dr. Abaya said earlier, about how to change the culture of violence. For urban communities, this is what you just mentioned, Councilman Johnson. This is the street culture, the code of the street, the culture of violence. Within a public health framework, then, we should be asking, how do you prevent violence? How do you prevent the victimization? How do you prevent the trauma? And I've been asked to talk about data. It can be a little boring. But thinking about data, we need solid data in real time that provides information about these risk and protective factors across multiple domains of influence. And when you think about multiple domains, that's the individual's relationships, the networks that you were mentioned, the peer groups of kids, that's the community, the neighborhood, and the larger societal factors. Unfortunately, that kind of data sits across multiple systems, and these systems are siloed. Citywide indicators, we always hear people talking about, let's have output measures, let's have performance measures, but these citywide indicators are not sufficient. We need to be able to understand risk and resiliency at the neighborhood level. This means who is vulnerable by place. Place can be as small as the neighborhood, the street block, or even an intersection. And when we think about networks, the personal networks, we're thinking about individuals, their gang affiliation. Were they arrested with somebody else? Were they or are they on probation or parole? Are they in foster care? These networks and understanding how they play out are just as important. So if we recognize that neighborhoods and street blocks have their own cultures and norms, that leads us to thinking about the pieces of information that we can systematically collect to address this. So I want to mention 6 areas of data, but just focus on 3 of them, and those are population surveys that assess risk and help you understand the neighborhood context. Then there's law enforcement records. We have arrests, incidents, calls for service, but we also have information about gangs and groups, who's doing what together in those law enforcement records. We have emergency room records. We have crime lab data, death certificates, medical records, and administrative records about the environment, the physical environment, boarded up houses, what's happening with streets, what's happening with lighting. So to mention the first 3, surveys, I think population surveys are really important if they get to the neighborhood level. These kinds of surveys are surveys that let us know how things change over time. If 2 types of risk factors are co-occurring together, we can also address what's happening to boys versus girls or subpopulations by age. You can compare neighborhoods. But how do we get this data? Fortunately, the City of Philadelphia has been involved in the CDC biennial survey known as the YRBSS, the Youth Risk Behavioral Surveillance System. There's also the Pennsylvania Youth Survey. It's sponsored for all of the Pennsylvania counties. The school districts themselves can have access to the data. But again, these aren't data that are available at a small level of understanding. We don't necessarily know the youth who take the survey, or the individuals who answer the survey, where they live. But we do have models around the country who have been using population survey data with neighborhood indicators, and Boston is a great example. They have a standout model. The Harvard Youth Violence Prevention Center has a partnership with the city of Boston, with the different government agencies, and they support a neighborhood survey and a youth survey, and they tie it together by the census tract of the individual, and then they also add emergency room data and law enforcement data, and they use that to create a strategy and have actionable results from that, an actionable plan which they can follow up and measure. Another example is what New York City is doing in an initiative they call Neighborhood Stat. It's a CompStat-like data system maintained by the NYPD that collects resident data on a smartphone daily that they aggregate and send into a CompStat system so the police can be talking by neighborhood, by police beat, even smaller than the police beat. They can have an understanding how the residents feel about their neighborhood and relationships with the police. It's real-time information integrated into daily meetings. Also wanted to mention a neighbor of ours, Camden, New Jersey. Through the leadership of the Camden Coalition of Healthcare Providers, they're successfully using an integrated data set from the 3 big hospitals. They have emergency room data that they link with arrest data, and they've used this to create a system of response called healthcare hotspotting. Right now, it's not being used to address violence. They have plans to do that, but what their healthcare hotspotting does is say, who are the people that are using most of the resources and have most of the needs. And then they're learning from that, creating interventions, these tertiary interventions that they then could say, we're going to take this to scale to affect the entire community. So this type of tertiary prevention, as Dr. Abaya talked about, the tertiary prevention, fortunately, we have pretty good experience with here in the city. So I just want to briefly mention what Commissioner Farley already mentioned, the ceasefire, cure violence public health model that was operating in North Philadelphia, and the focused deterrence program strategy in South Philly. And I went with you, Councilman Johnson, to that initial training in New York City, and we're fortunate that both initiatives have been successful in reducing community level, these are aggregate level rates of shootings, 35% over 2 years in South Philadelphia and 32% in North Philadelphia. But the city has not replicated or expanded these programs, and I think part of that is because we don't have the data at a smaller level to say, what are the mechanisms at work? If we knew that X leads to Y, we're going to do this, and we're going to target these individuals and get this result, I think we'd have a lot more confidence in expanding these programs. We also have the case in South Philadelphia where the initiative was not only attempting to reduce overall shootings, it was focused on the particular groups, the gangs that were doing most of the shootings. But what we did not find with the evaluation, we did not find that those particularly targeted gangs had reductions in shooting. So that puts some of the mechanisms about the intervention into question. If it was a public health intervention to send a message to change the culture of violence to these particular gangs, what was it? And we have some hypotheses about that, but how do we work with this program to increase its effectiveness in this regard? So we have some questions about that, but what that brings to mind is both ceasefire, cure violence, and focused deterrence are tertiary prevention programs. They are intervening with the most at risk. People who have already suffered harm are involved in the criminal justice system. There are other programs out there. The Department of Justice and other government offices, federal offices around the country have cultivated and synthesized evidence-based programs and practices. And on the primary prevention side, when it comes to aggressive behavior and community and gun violence, there are a number of significant programs there. But again, we have an issue. We need, in Philadelphia, we have a very large community with fragmented services. We don't have a priority, which I hope this special committee we will now have with the resolution, to create a strategy where everyone is on the same page. When we had a youth violence prevention strategy a few years ago under the previous administration, Temple University, I helped organize a survey to look at the use of services for youth violence prevention throughout the city. And we surveyed over 100 organizations that provided services to youth in the 22nd district of the city. And of the 100 or so organizations that we surveyed, only 12 of them, only 12, when we gave them a list of 14 evidence-based primary prevention programs, only 12 out of 104 said they were doing one of the 14 programs. There is a disconnect, and I think it's not that the providers in the city don't know what to do, it's that we haven't coalesced around a strategy and key priorities and key models for prevention. So I just want to conclude and say, you know, I mentioned a lot of different aspects of the public health framework and how we use data, but I think the two most important things are coming together on a strategy to use cross-systems data that creates actionable steps that have palpable objectives that then can be measured, and when things work, we think about them carefully and how to bring them to scale. Thank you.
Thank you. Any questions from members of the panel? Can we start? Chairman O'Connor?
That was excellent. That was very informative. Thank you for that. From what you know in the city of Philadelphia, what do you have some recommendations?
I have a lot of recommendations. I would say there are a number, and I am so appreciative of what Dr. Abaya said and Commissioner Farley in thinking about the public health framework. It sends us to comprehensive reform. And coming from DC, where I've had the opportunity when I worked at the Urban Institute to look at models all around the country, what I have seen is what works is when you are doing primary prevention with secondary prevention and tertiary together in a organized way that has one unified objective. So if you say we're going to take the 25 hot spots of gun violence in the city and do something, you don't just say, oh, let's give some kids jobs here. Let's fix some abandoned buildings here.
Right.
It is a strategy where everything works to the same goal with community buy-in. And there are a number of models, roadmaps to follow. One of them is it's a horrible name. It's called the Comprehensive Gang Model. It's not just focused on gang activity because it has prevention, intervention, and it does have pieces of focused deterrence in it. How do you deal with the kids that are doing all of the shootings? So the comprehensive gang model would be one of my suggestions. The second one would be having case review teams for the most vulnerable children, where the trauma is the worst. Don't do a death review where you're talking about, kids that have already passed away, or a homicide review. You can have something. Milwaukee has a great example of a homicide review team that makes it actionable. They're reviewing homicide where there is a decedent, but they're actually using that to go back and say, since many of these homicides came from conflicts and retaliations, they're going back and saying, this is what we need to work on. This is what happened here, and this is what we're doing comprehensively. And there are more than 24 organizations that sit around the table bi-weekly to work together on that particular issue. Those are just two.
Thank you. As a follow-up to that, let me just throw this out there. And see what you think about it. I'm all for community policing. I think it's very important. And we all know the police department is overwhelmed and they have many, many responsibilities. They do the best they can under the circumstances and the funding that they have. And we have many people here in this room that are out there in the community, and they do fine work, intervention with the community. But I always thought to supplement community policing, when you identify certain sectors, police departments operate in what they call sectors. If there was someone other than a police officer, maybe a social service person, that's specifically assigned to maybe like a several block area where there's a serious problem, and they're there to interact with the community on all levels, that's the community's go-to person. Like I'm talking about like 3 or 4 block radius. This is the go-to person. You got issues, anything comes up, they know everybody in the neighborhood, blah, blah, blah. Anything comes up, then they can pass that information on to those agencies that need to really go and target the problem. Do you think that a little bit more concentrated, personal, the only thing I can equate it to is like the parking authority. Okay, the parking authority, they got parking people write tickets. They have a sector they run.
People hate the parking authority.
Everybody, that parking authority person knows where the bad spots to park at. Okay, so I'm just saying that if you have a person who's more dedicated to a specific types of sectors, and people can come to that person and say, listen, I got issues, we got problems with this, we hear rumors, we hear this, we hear that, and that person would then address the problem. What would you think about something like that?
That person has to have the power to make change, and I honestly believe it's not just about policing. In our city, we have the community liaison officers, and in the 22nd, but I think you're right about saying they need to be smaller areas. That would be the first thing. What our community liaison officers do is fantastic, but it's almost too much work for them. So there needs to be a smaller area, and they need to have the power to make the change that the residents want, because sometimes the change is not necessarily related to policing. It's I can't walk down the street because there's no street lighting.
I think, and I'm going to let Chairman O'Connor follow up just for clarity, but I think separate from the Philadelphia Police Department, community relations officers, I think he was going in the direction of civilians that would actually be the individuals on the ground in certain zones, working in partnership with the issues that the people may have in the communities. Is that correct? That's correct. Okay, I think that's
Civilians,
the direction he was going into. Civilians, yeah, separate from the Philadelphia Police Department.
I think, again, because the issue of community cohesion, collective efficacy, we know from the academic literature that having this cohesion around the neighborhood and the trust in the police, that is so important. I honestly believe that's the mechanism to bring crime down in neighborhoods, by having the residents want better for their neighborhood, and having those trusting relationships is really important. There are a number of experiments going on around the country using social media to get your neighbors together, to get them informed. I don't think we have the data, and the evaluations aren't fully in on those, but I think experimenting on that side is definitely worth it.
Okay. So, 1 second. Dr. Fine, and then Ms. Garcia.
Dr. Roman, thank you. You said a lot of the things that a lot of us have been thinking for many years. One of the things you mentioned about the Boston model, and possibly even in Milwaukee, is the ability to collaborate with data collection. What have you seen in your years here in Philadelphia are the barriers to combining data and utilizing the data for public health purposes in the city?
I think the biggest barrier in the city has been there hasn't been a unified vision from the stakeholders on what it means to reduce violence and how to get there. I think Dr. Abaya also mentioned, or it might have been Commissioner Farley, the language that we talk about and how we say perpetrators or offenders, and we're thinking about arresting and moving from that and talking about harm and community harm. I think that's a big understanding that data, understanding, as I mentioned in my testimony, how to get to resiliency, that it can be done, that there actually are solutions, and staying focused on that goal could be helpful. I know that might not be the answer that you want, but I don't think we've had a unified vision for violence reduction.
And I think that is, I just follow up to that is exactly what one would need to start with. I think the other thing I was going to ask is if those communities that have accomplished this have used the public health model system to allow the transfer of data, because there's a lot of blockage from one system to another, like you're not allowed to see my data. And in a public health model, you say this is like HIV. This is a public health problem, and therefore we should have exemptions against the block that we have sharing data. And I wonder if those systems have used that in the public health world.
There are ways, and again, I think the beauty of it is that there are other cities that can serve as models to issues with data sharing. I think Camden does it well, but Camden is a city less than an eighth of our size, so it's difficult to say. But if you take HIPAA, you can have disclosure of information under HIPAA if you are a valid public health authority, right? And so there are ways to situate the data and particular elements so it can be shared.
Dr. Roman, thank you for being here today. I always have a lot of curiosity about the dynamics and interventions in terms of gun violence. Looking at the numbers of homicide over the last 10 years in Philadelphia, they seem to stay relatively the same, with the exception of going up some percentages or going down some percentages. And then I looked at New York and looked at Chicago and saw the massive differences in their homicide rate. And also, that's one question. What you suggest would be of a more immediate response in terms of, because I'm always thinking that this year, more people will die. Next year, more people will die. What is the most efficient and effective intervention that the city of Philadelphia could look at based on what New York has done or more successful cities have done that you would suggest to us today?
That's always hard to answer because here we are advocating for primary prevention, which could be something like the nurse-family practitioner partnership. But when you're talking about what giving a nurse to a young, pregnant, high-poverty woman, when you're looking for outcomes related to crime, that's 16 years down the road. So this is a tough question to answer, but for me, I would say that there are initiatives like Becoming a Man. If we've heard about Becoming a Man as a cognitive-based intervention that's been done in Chicago schools, where it takes at-risk youth, and it was evaluated with a experimental design and found to have very strong reductions in arrests and violent behavior in the schools. And this has not been, and I've been talking with a number of people trying to think about if it would be possible to bring Becoming a Man here. I think it might be expanding to New York City as well. If you are looking for what can we do immediately, something like Becoming a Man, which is trauma-informed cognitive behavioral, but the but is, as I mentioned with our multiple domains, it doesn't work with individuals in their peer groups. It takes kids in a school setting and brings them into the room with a counselor. In my mind, if we're really going to affect change, we have to take into consideration that Katerina is hanging out with Caroline, and Katerina now has the intervention, but Caroline does not. What does that mean? But I think there are ways to shape the intervention in the immediate stages to address that peer group, to reduce the code of the street and the culture of violence that supports retaliation and carrying a gun. But it has to be, you cannot do this without money. Focused deterrence. I love focused deterrence. But if you were to take me aside and say, what can we do to build that up? Those individuals want social services. We can put law enforcement on the street and do better coordinated law enforcement. But until you have those jobs for those individuals who are ready, they're trusting in you. When you say, we're here to help you if you want to get out of this lifestyle and stop shooting, a job that is relevant has to be there. You have to put your money down. And I think it would be the same with something like Becoming a Man. That needs trained counselors to do that and trained follow-up.
So happy we have the mayor's office of Managing Director's office here participating in this process. Councilman Curtis Jones.
So, you won me back in your, you lost
My boring
me.
data talk,
No,
I
you
fully
actually
understand.
You actually lost me for a minute, not because of the boring data or anything like that. I didn't hear the complete circle that sometimes we can oversimplify something. And what real people in the community have to deal with is a level of stress every day. And whether it's Maslow's theory of hierarchical need, which I heard of that, and it says that until you're warm, you won't care about food. Until you eat, you won't care about where your house is, and so on, about a job, and then your career and what you actually are remembered for. So it's a hierarchical need to be satisfied. So in our communities, I like to, like on Monday, you might find out the gas is getting cut off. On Tuesday, you realize that you got a layoff notice on an underpaying job that you're getting laid off. On Wednesday, you find out that your lady is leaving you because of those other two things. By Thursday, you got an eviction notice, and on Friday, you wanted to go out and have a little bit of relief at the neighborhood tavern, and somebody knocked your last $20 drink over, and you disrespected me in doing it. That pressure cooker is more likely to be than any drug wars or anything out there. The reason for the homicide is more those kind of daily life pressures that are going unresolved. So you won me back when you said, we have to, if you solve the job problem, I'll take care of all of those other gas, this, that, and the other, to take some of that pressure off me. The best crime prevention thing is a steady job. Because guess what? I can solve a lot of those problems, including, I feel a lot better about myself, knowing instead of Friday that I got a job to go to Monday. I'm not going, it's like that poster, what happens next? There's a Monday after this crisis. So we have to solve those human problems in neighborhoods.
So I want to follow up, and I'm going to push the envelope on this, right? Because I interact with, I have at least my ear to the streets, and I kind of get different information on what's going on. I still live in Point Breeze, right? So we got the job component, because I know a lot of times if I get a young man in a construction job, he's too tired to hang on the corner, right? He could take care of all those things that he wanted to take care of, rather sneaks, rather taking care of his baby mom, paying the rent, and so forth, and that makes life a little easier for him. But there's also another component in terms of mental health, right, that often goes unnoticed inside the community. Often when you look at the issue of drug addiction, right, it's addiction regardless if we look at it from a recreational standpoint or a young person is totally just addicted to opioids. They take Xanax, Percocets, pills is like the cool thing to do for some of these young people, drinking, liquor, and so forth, right, and smoking embalming fluid, right, as a way to cope with the harsh reality of life. And so an argument on social media can go from 0 to 10, taking somebody's life because they feel disrespected on social media in terms of how they respond to a person so-called disrespecting them. And so I also look at that part that has to be addressed from a mental health standpoint, right? When we talk about public health and addressing the behavioral component of some young people, because you have a lot of young people just coping, living inside our neighborhoods, particularly poor neighborhoods, getting high just to let life go a little easier on them. And so that's another component, right? Because I oftentimes I hear, well, we get them a job, everything's going to be great. But I meet a lot of young men, I don't want a job.
And don't get me wrong.
This is what I do. This is what I'm about. This is the street culture, lifestyle is what I bought into. And they're kind of the harder ones that we try to focus on trying to get them to express themselves in something that's positive as opposed to living that same type of lifestyle. So I'm agreeing with what you're saying, but I also just look at other components also to kind of help the totality of a person to try to get them on the right path.
And I'm not saying that a job is the answer. I think
I'm agreeing with you though in terms of we need the resources because we're never going to rest our way out of this situation, right? And so why I'm agreeing with you, because I read a study that one of my staff members that gave me in Chicago. They had a program that they solely focused on the reduction of gun violence based upon the level of resources that were put in a high poverty area. And the level of gun violence just totally went down based upon the resources that were poured in that particular zip code. So I'm in agreement with you, but I also look at the mental health component, behavioral health component as well as a part of a person's being and why they be carrying the guns. That's all.
And there's a stigma, and I think we all know that, with young men and women going for mental health services. Mm-hmm. And I think that, again, is part of why we see interventions like ceasefire, those that have street outreach, using a credible messenger to say, here's me who's been like you, and there are other paths here. I think that's important. I just want to say, when it's in my written testimony, but I did not have a chance to talk about it. In my other work, besides the evaluative work that I do, I had a study to look at gang leaving, what makes youth and young adults leave gangs. We interviewed 150 youth between the ages of 15 and 25 in Philadelphia, another 115 or so in Washington, D.C. And when we looked at the reasons for leaving, they have a lot to do with who is in their social networks. If there was leverage, if there was someone pro-social leveraging some, like Councilman Jones mentioned, some bad event, when you take the bad event and you put it with resources, with people that are maybe offering you a job or a place to sleep. You can't live over there because he's going to shoot at you. You need to come over here. It's not just the job. That is, I truly believe that it's not just the resources. It needs to be the human capital augmented with that kind of financial capital too.
I agree. Before I wrap up, I just want to ask Shondell, who runs the Office of Violence Prevention, just to give us an overview and his perspective on reshaping, because you talked about the key component about, you said there were a couple organizations that was doing work, but the lack of data being provided kind of hinders the progress of moving forward and addressing this issue. And his primary purpose under the Office of Violence Prevention is to look at all the resources that are spent on behalf of the city of Philadelphia, how those resources are being spent, but most importantly, are the programs being effective at getting the job done in terms of addressing the issue of violence prevention. But the data sharing component, I also want to get his perspective on, because that's key. If the left hand doesn't know what the right hand is doing, and I think Chairman DeBardinas approached me about the diversionary programs. We got like 1,000 diversionary programs here in the city of Philadelphia, and does the left hand know what the right hand is doing? And so Shondell's responsible for addressing those issues.
I think through your testimony, a few key things that you said that really make sense and that we're working on is looking at all the programs that we have across the city and asking the hard questions that, yeah, they are effective, but why is the violence still going up? And from a city's perspective, when we created this office, we looked at how can we better support these initiatives. And yes, a lot are working in silos, which is somewhat an issue. And then you have to ask the question too, since the program has been in the area for so long, is it still effective in that area? And just because, I just have to be blunt in saying, just because someone gets out of jail and has, a great will to help people, are they real effective? So we have to kind of take a look at ourselves first, and in the city and what we're doing on a positive level, but also looking at all the resources that we're paying for, and saying, are they in the right areas? Are they being mobilized correctly? Is the city supporting them correctly? And then do they have the proper people to kind of work these initiatives? So you did hit on a few positive notes that kind of inspired, because I think we're on the same page here. But the hard part is the evaluation and looking at not only what we're spending money on, but also going further, finding out how the community looks at these organizations and these initiatives. Because we know so much that if, no matter how good the organization is, if the community doesn't see it as a positive asset, then it's not going to be effective. So we're asking the hard questions, and we're starting to looking at all the information that's gathered and trying to support a lot of agencies. You have a lot of mom and pop agencies out there, smaller agencies who are doing great work, but haven't been funded, and why not? So we're asking that question as well. But I think moving forward and what we're doing, we're not only trying to just find out whether these organizations are being effective, but also trying to target the populations that have the most distress. We're looking at blight, and how can we counteract that? Because some people aren't employable. They're not at that stage yet, so we can't throw a job at them. So we have to look at simple things like how can we feed them? You have a lot of young men living in abandoned houses, in a simple argument over, a loaf of bread or a beef patty will lead to a homicide. So how can these organizations 2 blocks away help those individuals? And I think that's where we're at.
I think that's really exciting. Mastery Gratz is moved from taking ceasefire in the schools to reduce violence to helping feed the kids and focus on truancy. Exactly what you're talking about, Shondell. They took some time to reevaluate how do we start, what does the community want, and ended up focusing on having breakfast meetings with the students and moving that into truancy reduction. It was I think that has a lot to do with what you're saying, so it's exciting, the work that you're doing.
Okay. Any other questions from the panel? All right, thank you very much for your testimony. Can the clerk please call the next panel, please?
Michael O'Brien, Mary Beth Hayes, and Robert Reed.
Greetings, everybody. I appreciate this opportunity to
State your name
share
for the record, please.
with you. Oh, I'm sorry. My name is Michael O'Brien.
How you doing, Mike?
No problem. How are you? So again, I'm thankful. Closer to me, no problem. Thankful for this opportunity. It's my first time in testifying in council, so I just want to put that out there. I want to honor the idea of accessibility to firearms, but I do want to note that that's not what I'm here to talk about, though I think it is a huge issue in our city, and I do want to honor the work of a number of city activists and community members who are trying to figure that out, because I do think it is a huge issue and a complexity that we've got to figure out.
Let's back up just
yes,
real
sir.
quick, Michael, before you start your testimony, because I don't want that statement to go unnoticed. You're saying to access the guns, right? How the guns are coming into the communities, correct?
Yes, sir.
That's what you, okay. All
Right.
thank
Just
you.
want to note it as a huge problem.
It's a
that
yeah,
does
it's a real
need to
big
be-
problem.
Right.
Yes, thank you.
But I'm here to talk about my work in community engagement around issues of trauma, and my work really not just around engagement, but of working with communities to try to build solutions that push them towards a trajectory where violence is a normal occurrence. Very, very normal occurrence. I do work at the Village of Arts and Humanities. Primarily, I'm the Director of Youth and Young Adult Programs. We're in the Fair Hill neighborhood. We are legitimately, we're 10th and Germantown Meet. We own 10 row homes in that area that we do a number of programs and offer a number of programming out of to the neighborhood at large. My role is focusing on 9 to 21-year-olds specifically. I have this audacious goal to try to get up to age 26 included in my services, but funding is real. So in context, my work didn't start there. I actually got introduced to the idea of trauma-informed care 10 years ago when I was 22. I had graduated the University of the Arts as a music major and ended up at a family emergency housing facility in North Philadelphia called the Salvation Army Red Shield Family Residence, where about 6 months prior to my joining their staff, they had just taken on a model called the Sanctuary Model, created by Philadelphia's own Dr. Sandra Bloom. And they were the first emergency housing facility in the city to take that model on. The Red Shield is also a very unique place in general. I identify there so hard. I was there for 7 years. I didn't imagine that's what would happen when I walked in the door, but I stayed there for 7 years. The Red Shield will take in families of all size and makeup. So it's a very interesting space and place to actually situate a model like the Sanctuary Model. So we service families that had dads in the family. We service families that had a partner that was male in the family, even if he wasn't biologically the parent of the children. We could have boys stay with the family who were over the age of 14. Just again, very uncommon in the emergency housing landscape of the city of Philadelphia, but it also exposed us to the complexity of trauma, historical trauma, and the ways that people adapt and change to circumstances that are very much so out of their control. So I just wanted to give some context to some of the things I'm going to share with you briefly. I also want to highlight that a lot of my work actually included this gentleman to my left, Mr. Robert Reed, working with him and the Department of Justice locally here to address youth homicide and community trauma in the 22nd Police District. We did that for 3 years. He was doing that work before I was with him, but I was with him for 3 years. Over my 10 years of work in this world of trauma-informed interventions and practice, I've come to understand the power of environments, psychologically, biologically, and socially. I've read a lot and been able to talk to a number of researchers from a number of fields. There's one in particular that stands out to me. She's a neonatologist at CHOP. Her name is Dr. Hallam Hurt. And she did a landmark longitudinal study around the crack epidemic as it related to young people in gestation and then their development throughout the lifespan. She, I think, stopped when they reached somewhere in their mid-20s. Dr. Hurt's research talked heavily, by the end, about the power of environments. Because what people assumed would happen is that if you were born addicted to crack, you would just be bottomed out. That was not the case at all. The opposite is that people assume that if you were born not addicted, you would be fine and developmentally you'd work well. That wasn't the case. I'm buttoning down her research a bit and not doing it justice, but at the end of the day, after 20 plus years of research, using a number of psychological and biological tests, what has really come forward is the power of environments to shape behavior, decision-making, to shape how you think through problems, to shape how you know when to ask for help or if you ask for help. And so really what I think about in that context around environments is that emotions and our emotional well-being are a public health concern. Historically, there are a number of people who have seen violence visited upon them over and over again, and not just gun violence, physical violence, whether it's abuse or violence at the hand of the state. The city has a very, very intense history with racism. We were talking about it with the Rizzo statue. There was just a commemoration around the 1967 student walkout. I mean, we have a long history, and that's just the end of the 60s. You're going back roughly 50 years. We have a long history of violence beyond guns that has been visited upon communities that have been sequestered and sanctioned off or sectioned off to themselves. And I don't know if gun violence can be viewed separately from that context. The other thing I want to point out, and I want to quote Toni Morrison on this, her last book is actually called God Bless the Child. Interesting article in The Guardian. She wanted to name it The Wrath of Children. She said that the book isn't just about anger. She says it's about something stronger, about children's fury, about what adults have done to them and how they tried to get through it and over it and around it and how it affected them. That quote arrested me in my soul because, again, with the issue of homicide and gun violence and trauma, I think sometimes we are short-sighted in how we're looking at contextualizing the problem and how we're looking at long-term interventions to solve the problem. I think what we are seeing, whether the violence is through mobs that we get riled up about with flash mobbing and the violence that comes from that, or whether it's literal gun violence, we are watching the wrath of children that I think is explained quite beautifully in that quote from Toni Morrison. And so what I want to submit for your consideration from my years of working with families, I tried to start a process of counting how many families and children I've worked with in 10 years. And by the time I literally got to 1,000, I stopped because I was nervous for myself and what that would mean to me. So I want to share with you that John Powell, an academic, talks about that whenever we're considering policies to address poverty, it's important to have a sense where populations are situated within our national imagination and within our national structures. And I want to ask you, could you imagine Fair Hill, that region? Can you imagine Camden with a space and place where violence is normal? Can you imagine if Amazon did go to Camden and drop 50,000 jobs in the middle of Camden? It wouldn't solve violence, but it would do something that I think I know I've heard over and over again echoed from every community member I've ever worked with who's lived on the side of constant stress and constant exposure to trauma, historically, intergenerationally. Jobs, jobs, money, jobs, jobs. And it can't just be jobs that allow them to go work at CVS. We are at a stage and point in the development of our economy where people are talking about the imagination age. We're leaving the knowledge age and moving into a space or place where creativity and complex human emotion-based skills are going to be the crowning achievements or markers for the kind of work that would create a sustainable life. The idea of getting a job where you can go to CVS or just push leaves, that's kind of out the window now. particularly for the young people and the families that we're talking about, if they're going to get a livable wage, which is what I hear them scream about over, and not scream in a way that's belligerent, but it's a plea over and over again. We've got to think about how we bridge them out of that. I guess the question that comes next for me is, how much risk is acceptable? How much ecological, biological, economical, psychological risk are we willing to allow people to nest in? That's a question I think we have to ask in the context of public health and this idea of epidemiology. When we know it's that complex and layered, are we comfortable with that and sitting with that? And are we thinking about what are the long-term, I can't see that at all, sir, 1 minute, thank you. Are we comfortable with what it means to try to move forward in a way where we understand the answers we're seeking for have not been built? That is what my work and research have shown me hand over foot. I'm doing work in Richmond, Virginia, training police officers on a 2-year contract around the adolescent brain and trauma theory. And what's fascinating, again, as I travel, people are searching for answers that don't yet exist. I want to close with offering something that I found that the Office of Neighborhood Safety in Richmond, California is doing. They created an 18-month fellowship program that's similar to any postgraduate fellowship program, but this one is designed specifically for active firearm offenders who've avoided sustained criminal consequences. This is from a CNN article. Each fellow commits to promoting peace in his community and to a life without guns. They get hooked up with jobs and anger management experts. A life map is provided detailing the barriers they face and what they must do to overcome them. 6 months into the fellowships, the young men can apply for the monthly stipend, which can go up to $1,000 depending on their participation and achievements. Most earn anywhere between $300 to $750 a month. They can make this money for up to 9 months. During the fellowships, the young men meet with mothers whose children were killed by gun violence. They visit colleges and they meet business leaders. With the help of private donations, they've traveled to places like the nation's capital and Chicago, as well as outside the country to spots in Mexico and South Africa. And once they're done through the program, it is possible for them to reapply for another 18 months. This is the kind of creativity, innovation, and ingenuity we have to look at. We cannot any longer say that someone's mental health weighs more than their economic well-being. I'm going to submit to you that they're in our city, at least, I'm going to talk locally, those two things are inexplicably tied. And there's no way to tease them out. For the folks that we're talking about who are most at risk to gun violence, think about the things that lead them on that trajectory. A lot of them are connected to money. Thank you very much.
Fellowship program again?
That's a good question. So I think it's Operation Peacemakers.
Okay,
I will look that up for you right now.
all right, thank you. Next. Please state your name for the record, please.
Yes. Good afternoon, Councilman Johnson and the committee. My name is Mary Beth Hayes, and in my testimony today, I come to you with over 20 years of providing outpatient therapy, social work support to those affected by gun violence by way of co-victims of homicide, individuals who have sustained non-fatal injuries, and witness to community violence. I have trained in contextual family therapy and continue to train, and I am a professor of mindfulness-based play family therapy with a contextual model. This is important in part as I have co-authored a chapter about families who experience homicide as it pertains to Dr. Bloom's work in looking at the sanctuary model in the city of Philadelphia. Currently, I'm at Temple University and I serve as a program manager, community intervention specialist for the Healing Hurt People program, which is a replication-based model originating out of Hahnemann and St. Chris. But in fact, the intervention program at Temple is specific to serving the medical and behavioral and social service needs of victims of interpersonal violence in Philadelphia. At Temple, we're serving both men and women of color ages 14 to 30. The program focuses on the victims of interpersonal injury, whether they've been shot, stabbed, or assaulted, that are seen in the emergency department and are at risk for recurrent injury, perpetration by retaliation, or death, and to address both the physical and psychological wounds of trauma. Case managers meet individuals in the emergency department or soon after discharge and navigate them to behavioral health, primary care, and enroll them into potential insurance providers such as Medicaid. HHP's goals are to decrease emergency department visits for violent injury and decrease contact with the criminal justice system. HHP has been funded by the Department of Behavioral Health and Intellectual Disability Services since 2007. Our goal is to transition HHP from grant funding to a sustainable reimbursement model. More recently, CBH, the not-for-profit corporation created by the city to provide mental health and substance abuse service to Medicaid recipients, is assessing the process of reimbursement for clinical services delivered by HHP at Temple. The goal, I think, in looking at HHP and how we're trying to intervene in this, there's an evaluation at HHP that's providing data on the medical, the behavioral health, and the social services received by their clients, and controls over a 6-month period after injury. Data are being gathered on re-injury, criminal justice involvement, and key mental health and medical outcomes, including post-traumatic stress disorder, substance use, and functional status. Recognizing the power of HHP and impressed with the support of the Philadelphia DBH-IDS provided, the Casey Foundation and the Stoneleigh Foundation have also joined the HHP to support research in an effort to demonstrate the effectiveness of HHP at the replication sites in addition to the original hospitals. The research is also innovative that it builds on an array of existing data across the 4 hospitals, including data from an ongoing evaluation study, case management data, and healthcare utilization data, and uses this data to inform and design the new model of care. I think I can speak to the experience both as a social worker and a therapist in our city and the unfortunately high rate of violent injury. And my goal is to put forth a testimony as clear as possible in my belief that there is a need to pay attention to the public health strategy that recognizes the strong link between early childhood adversity that you've heard much about today and exposure to violence and the types of violence that we see among young people in the emergency department, most of who are young men of color. And so the idea, in particular, I'm working in collaboration with Ceasefire at Temple. It's been a productive program. I've been there since May of 2015. I can bring to you a couple of case examples where we were able to best utilize our techniques and our skills. There's a woman that we interface with. I met this woman at bedside, 27-year-old African-American female, who was treated and discharged from Temple's ED due to an orbital fracture and a broken tooth. When I had met this woman, she was very distraught. She agreed to not only receiving HHP services, but she allowed me to call in Ceasefire, so they too met her at bedside. And in that time, the phone calls were made, the assessment was made, and before this woman was discharged, there was an idea of safety, which is a primary concern of HHP, not only physical, psychological, and emotional, of what the status was to the neighborhood to which she was returning as it pertained to retaliation, and the safety of her 2 children, ages 2 and 4, and her partner, in part in hopes that he would not become a defendant in protecting his own family. So this kind of success goes on regularly. This woman did have, she did present with enough of a high scoring that she did present with PTSD and some mild depression. The services that we were able to navigate from a case management system included PHA, Northwest Victim Services, RHD for ongoing behavioral health, but ultimately the outcome for this woman, given the intensity of the case management, she was able to successfully return to work with minimal impairment. We were able to get her outpatient surgery through Episcopal. All things considered, this was what we would consider something successful. Another case that I'm working with actively, there was an 18-year-old male who was shot in his leg. He came to the ED, he was discharged. Shortly after he consented to treatment or to become an active participant with HHP, he was arrested for another kind of alleged charge. He was held at State Road for a good amount of time, in which I continued contact with the individual and provided a tremendous amount of trauma-informed care for his family, in particular his mother, his stepfather, and his sister that had just not only come to terms with the fact that their loved one had been shot and survived, but now he was incarcerated, allegedly wrongly. And so upon his return, he knew and consented to ceasefire involvement so that when he came back to the streets, for an 18-year-old male that had a disruption in his life, right or wrong, had already been shot and injured, that there would be support for him intellectually, but also support for him in the streets perspective of when he returned to the streets, could we get him back into school? So this is a young man that we've helped from a very bottom line obtain a state ID so he can interview for jobs. He needed a state ID so he could get enrolled in a GED program, which he attends regularly. He needed to have support so we could communicate with probation when we needed him out and when we needed him to be available for services as he is currently on house arrest. We provide the court accompaniment so that we can talk with the Defenders Association about what this young man really brings to the table and how valuable he is to our community. And so these are the kinds of collaboration that make it really clear for me. I can come in with book smart, I can come in with over 20 years of experience, but the need for us to collaborate and work as teams as we see individuals, and much what you were saying, Michael, as a contextual therapist, it is impossible for me to walk my own life or look at any one of you and believe you are it. You come from somewhere. You come from a legacy, and to understand that trauma is contagious and it is inherited, and we all live with gifts that we were granted from our families that we appreciate and those that we wish we never took on. The idea is that the kind of behavioral health that we need to fully treat individuals amidst family systems almost does not exist in this city. The kind of clinical approach to treating families, to treating individuals with the family in the backdrop, where you're not putting a 5-year-old on a bus or a shuttle to get them to treatment. And the School of Psychology says, yes, better one positive connection, one opportunity for treatment is better than none. I won't disagree. But to hold that child accountable as a symptom bearer for a larger system that needs to be involved and folded into their care and their treatment is much more of a priority. And it is very difficult to find behavioral health services that don't look at medication first, that don't only treat the child and not bring in the family. It's very, very difficult. So if I were to task you with all of how I've come to be before you today and the gravity of being here, I would ask that we try to find systems that incorporate families. Ultimately, in contextual therapy, you look at trust, you look at broken trust and unfairness. And if everything that you said is true around the unfairness of how we all have come to this place today, that we have to begin to look beyond the child that is so enraged and symptomatic of so much injustice that they are going to destructive states instead of constructive states that we all are entitled to. So I love being at HHP. I love working with individuals who are alive. I worked in over 20 years of working with homicide. So I'm delighted to be here, and any opportunity beyond today that I can further this kind of a dialogue, I'm happy to sit with you and before you, and I'll take any questions, of course.
I want to acknowledge also the presence of Councilwoman Helen Gim for being here. Thank you for taking time out of your schedule. Mr. Reed, please state your name for the
Yes, hi, I'm Robert Reed. I
Rob,
am...
just 1 second. I think the councilman just want to do a
I'm at
quick
the age
intervention.
where if I don't say what I think,
I
it
understand.
goes somewhere.
So am I.
So, the level of institutional medication to our children.
Indeed.
I don't believe in HDD.
Yeah. So, I've seen young people diagnosed early, and whatever the motivation was, it mom and dad trying to get a check? Was it, in fact, their post-traumatic stress syndrome? In fact, but the medication is the instant answer. And is that, do you see trends of over-medication of our children?
Absolutely. I wish I could note it, and again, I may do a little Google here just one moment, but the idea that I think in comparison to China, we are 5 times more likely to medicate. And medication has a place, don't get me wrong. Sometimes it is useful, sometimes it is necessary. It is not my first go-to, nor would it ever be my first recommendation. The idea that oftentimes in other societies and other communities, they look at family first, they don't medicate. Then they look at school, they don't medicate. Then they look at the home environment or the community in which they're existing, and they don't medicate. And then they look at overall functioning in the world as it relates to academia and brain growth, and then they might consider medication. Whereas in the U.S., we tend to, this is not across the board, this is my personal experience in working with children for over 25 years, we medicate, and then we don't look at the family, and then we increase the dose. And then the symptoms get worse because the environment stays the same and there's no resolution and the injustice increases, so does the medication. And so the idea is that if we can approach things in all things and in a balanced approach, that is the greatest success. So the medication, again, I will not say that medication does not have a benefit, but I do not think it is a first go-to, and I have very little appreciation about how the brain in particular responds to trauma and medication as a reduction of symptoms.
See, I'm not ashamed to say when I was little and I gave my mom like a hard time, like over and over again. And so we had to go to CHOP. My mom said, y'all better talk to him before, I address him, right? But then we had to look at the whole family environment, and then we had to have conversations about what's going on in the household to try to get to the root cause as to, why I was acting out, that could have evolved as I got older into some other things in terms of behavior-wise, but it wasn't the medicine first. But I think we're in a different time and age where we go to the medicine real quick as opposed to doing the hard work to get into the root cause.
So my father, may God be pleased with his soul, he had a different medication. And it worked.
What was the name of it?
It was, if the mind does not comprehend, then the body will be disciplined. And he would take that strap to me, and I'm not, please, no one watching this, I don't advocate any of that. There's more modern techniques, but a father in a home helps. Father in a home that has the respect of their children helps. Father in a home who has good self-esteem about himself projects that onto his kids, and that's all I'll say with that.
And I couldn't agree more that in what you've described is that the body does keep score.
Yeah.
And in that, from a trauma perspective, it's very real. And the body has been keeping score for generations, and it's rare that anyone takes that into consideration. So whether it be the loyalty to incarceration, the loyalty to the block, the loyalty to the destructive qualities of anyone's household, wealthy or poor, the idea is that we do need to take a look at in how individuals are presenting in the world, in particular children, because their bodies are less likely to be regulated. And so when there is injustice, they let us know. And for whatever injustice is developmentally appropriate in the way that we absorb it, we really need to hold normal development well before we start medicating for what is considered abnormal development, which in all honesty is normal development. So, I think as we look at trauma-informed care, we ensure that our practitioners are walking it and taking care of themselves. I don't know how we enforce that, but it's something to hold true to, that we look at who the individuals are that we're asking to care for the individuals who are traumatized. Many of them are traumatized and have not done their own work.
Thank you.
Thank you.
Mr. Reed, how you doing?
Thank you. I'm doing well.
Thank you for being here
For the
today.
record, Robert Reed. I am right now the Executive Deputy Attorney General with the Office of the Pennsylvania Attorney General's
Yes.
General, and I thank you for this opportunity to be able to speak to you today.
Formerly at the U.S. Attorney's Office, thank
Yes.
you for always focusing on prevention,
Right.
being on the ground and working with us on these issues.
Thank you. Thank you. So let me just say that I think I know almost everybody in this room, many by first name, and it's a privilege to say that I've worked with so many of them because the work that has been done has been extraordinary, and I've learned so much. And I just thought that I could add a little bit to this conversation, although it's hard to follow the last two speakers on this panel because they were so eloquent. But I will say this, that my 35 years in law enforcement has taught me a whole bunch of things because I've really faced the issues of violence, crime, addiction, mental health, and a lot of hate. And, now that I'm traveling around Pennsylvania, and it's not just southeastern Pennsylvania, I see that even though the people in different parts of the state may look very different than Philadelphia, many of the issues are the same. First of all, I commend you for having a discussion on trauma and the public health crisis that we see with respect to guns. We also have one with respect to opioids. We may very well have one with respect to hate. And I'm here to say that as a longtime, really career prosecutor, that law enforcement is really just a small part of any solution that we come up with. That the lessons I've learned from the Joel Fines of the world and the Sandy Blooms and the other people who are the giants in this field or working in this field, including healing hurt people, has really changed the way I look at it. Yes, we can arrest people and we should arrest people, and I've done a lot of that. And yes, people should go to jail. I get that. I've done it. But the bottom line is that what we need to do is we really need to focus on really get down and understand what it means to be in a public health crisis, and to really see that the solutions are not, again, an armed force in a community, but it really is the effort to try to bring, I would say, connectivity to people. We live in a country right now that is so divided on political grounds, on racial grounds, and so many other grounds. We need from the first day to teach people not just that all people have rights under the Constitution to be equal, but we need to teach them what equality means. We need to really humanize the conversation, which is that we need to teach people about humanity. The one thing I have seen in working with Mike O'Brien and other people who do the great work and actually going in the community is that there is an absence of hope, and there is an absence of a future. And no number of police officers on the street is going to change that. We need to come together, and I know that sounds maybe even trite, given the way the state of our national dialogue is, but at least let's do it here, which is coming together as we're doing in this room, Black, white, Hispanic, Asian. We are coming together to say, we are people, we are treated equally, let's respect each other for who we are. And I believe that when we talk about trauma-informed care, this goes to the individuals who need to learn it. And we saw in Strawberry Mansion, when we tried to bring that to the community, that many of the people in the community were so terribly traumatized that they were so deeply suspicious of the government and me. Look how I look. They were very suspicious. But we need, what's that? But, the reality is that we need to humanize people so that people in Somerset County, where I've been, which 99% of the people there are white, can start to understand that people in Philadelphia really are suffering in the very same way. The people there are dying of the opioid crisis are dying in the same way people in Philadelphia are dying. And the stigma that we heard about before goes to mental illness, it goes to addiction, it goes to being in Philadelphia for people who are outside of Philadelphia. We need to start talking more openly about it. One of the things that we have tried to do, and I tried to do in the U.S. Attorney's Office, and I'm trying to bring it to the state as well, is to bring trauma-informed practices to the institutions as well. I mean, people like Healing Hurt People, Mike O'Brien, CHOP, Joel Fine, others, and Dorothy does it with her reentry program, Women Working for a Change. They are trying to give opportunities to people in a trauma-informed way where they otherwise wouldn't have any hope. They've given people a new start. But the institutions, as Dr. Bloom talks about, need to change as well. We can't just say it's all individuals. It has to be literally our society has to become trauma-informed. And so one of the things that we did when we started this when I was in the U.S. Attorney's Office, we provided training to the Philadelphia Police Department and certain officers in the 16th and 22nd District to learn about trauma and trauma-informed care. Why did we do that? Because, number one, it's a police wellness issue. I think it's a community policing issue. My view is that a lot of the police don't get it about the people they serve. And a lot of the people in the community don't get anything about the people that serve them. And so we need to break that division. We need to keep it from the separate silos, bring people together so that they understand what each is feeling. I mean, I know officers want to return home safe every day, but the people in the community want to live safely every day. But neither understand, I mean, I'm making these mass generalizations, but that was my experience. And one of the things that we saw was that a lot of police are experiencing either direct trauma or vicarious trauma in working in those high crime areas. And so they need to know how to take care of themselves. They need to understand empathy and what it means to be empathic, to walk in someone else's shoes, to actually understand what it is that the people they serve are going through. So we've worked with Dr. Berkowitz from, I guess it's Pennsylvania Hospital / Penn now, and Linda Rich, Altavis Love Craighead from the police department. And then we've worked with Dr. Bloom to do similar programs for people in probation and parole on the state and federal levels. We've also done it for people in the reentry area. So Dr. Bloom came to Women Working for a Change. I was blown away. The women there were traumatized, and they had suffered. You talk about adverse childhood experiences. These women didn't have a chance, but Dorothy gave them that chance. And we needed to give them that understanding and that help and that wraparound assistance. And that's why focused deterrence, and we did something, we have reentry courts in the federal level, we had a Project Safe Neighborhoods call-in program. These are all efforts to wrap around opportunities. They're not precisely, maybe the focused deterrence is trauma-informed, but the idea is to give people respect and opportunity. There has to be also the trauma-informed piece. So in my view, what we do need to do is we need to say, yes, police have their part, prosecutors have their part, probation officers have their part, but they as institutions need to much better understand the people that they're serving. And so let me just finish by saying, again, I would just underline this idea that we have to bring people together. We have to understand that we are all human. And it sounds, again, I'll use the word trite, but my experience for 35 years says to me that we will never move forward, no matter how many jobs we have, and even if Amazon comes to Camden or Philadelphia, unless we start treating each people with respect and a level of empathy.
So, we recognize my colleague, right, Rob, and I thank you for your perspective in terms of the institutions. I think it's cultural when it comes to a lot of institutions. When you look at the makeup of the Philadelphia Police Department, it's predominantly Caucasian as it relates to the populations that they're serving are predominantly African American, so there has to be a level of balance of diversity, but also cultural awareness in terms of, separate from the trauma, so officers know when the communities that they're working in, the different nuances of why people respond and act the way they act, right? And give you a classic example, in certain school settings, right? When you interact with a young person who may be acting out, depending on what school you're in and what type of teacher and the teacher's skills will determine if that child goes straight to the principal's office and gets suspended or a timeout and having a conversation to kind of really find out what's really going on. Young man coming to school, he's not eating. Mom might be on some type of drug. Dad isn't inside the household. So before I go ahead and suspend him because he makes this type of comment inside or he may act out inside the classroom, will determine my cultural background of recognizing how this person acts, why this person is responding the way they're actually responding. So I'm in agreement with you from an institutional standpoint and the type of I don't want to say curriculum or best practices, but really the awareness of how you're training the officers when they do go into the community. And I know a lot of great officers that I work with that's from South Philly, that's from Grays Ferry. They know I'm from Point Breeze, and these are guys that kind of just get it. So they're not just going to jump off the bicycle and say, you know what, I'm locking up this kid just because he got smart with me, but more so have that dialogue, that conversation with the young person. But a lot of it also comes to skill set and trainings and kind of just recognizing when you just put the cuffs on somebody. A lot of times, and I've seen this, and I'm going to turn this over to Helen getting after this, a lot of times it's not even really just putting the cuffs on them, but it comes down to respect and how you talk to a person.
Exactly.
And that go both ways.
And
right?
that goes to judges
'Cause
and prosecutors.
That's how the at least situations that I've been in and situations that I have seen escalate. I mean, a simple pullover conversation or a simple telling me to get off the corner, how you say it, how you go about saying it can determine if this situation escalates or not. But all of that goes into the type of training from an institutional standpoint. But when you talk about the prosecutors and the probation and parole, that takes it to a whole different level as well. So that's a good insight.
And just to follow up on your example, as Councilman Jones knows as well as I do, one of the things that we did institute in Strawberry Mansion, but a whole bunch of other schools, are these things called youth courts. And that was an effort to change the system from a punitive system where you would automatically suspend somebody to a restorative justice system where you would ask those questions, or at least give the child an opportunity to say, look, my dad overdosed last night, or I had to take care of the kids and I didn't get any sleep, and I was getting a call from my dad in the middle of class and I didn't know what was going on. So you get context. That's what's missing. And I think that the problem is that there's this division, the silo we've talked about, between institutions, between people and the served and the servers, and we have to end that. And it will require an extraordinary amount of training. And I think, though, my experience, and I've done a lot of work in the reentry area, and I have been amazed at even going and talking to correctional officers who you would, at least my own bias would be, no way. But I have had people come up after presentations, after meeting with people who have come out and done well in reentry, and they have been so open to the idea of looking at the people that they are guarding and serving in a different way. And I think that's what we need to get to as well.
Councilwoman, go ahead.
If I may, I'm sorry, I think there's something Rob just said about bias that I think plays a role in what you just described with officers and institutions. Cultural practices and behavior, it's not in what you say. And I think we'd be just not true to what we're talking about if we didn't just highlight that bias is a real problem. And the work of Dr. John Rich in that area, I think, is very important, right, as he's pushing forward those ideas. I just wanted to put that out. Sorry.
I agree. Councilwoman Gill?
Thank you very much, Mr. Chair, and thank you to yourself, to my excellent colleague, Councilman Jones, and to the members of the committee for allowing me to join your very important hearing. One of my questions for this really wonderful panel is one of our main efforts through City Council, and particularly through the Education Committee, has been to do a big push for social workers in public schools, ones that are not necessarily specifically attached to each student, but actually serve the entire school and take a more whole school approach towards services in the prevention mode, in the family-oriented mode, in the hopefully restorative justice practices mode, but definitely in the mode of trying to connect struggling families and young people with services before they get into a significant amount of more serious problems. So we actually doubled the number of social workers in schools, and we revamped the program through CBH so that it actually comes with a more service-oriented type of approach towards the whole school and the family. We haven't made yet, we've been trying to work on whether there is value in seeing that happen across all schools, as opposed to the 21, 12, 39 schools that we're currently in. out of the 200 and some public schools that we currently have. And I'd be interested in Mr. O'Brien and Ms. or Dr. Hayes, I'm sorry.
Ms. Hayes.
Ms. Hayes, in your reflections on that, whether you've seen that in other settings, how effective it is, and what we would need to consider if we were to try and make that case currently with the city and the school district.
Okay, so, yeah, for a good amount of my years, I provided therapy as it related to homicide in the schools as a non-school district employee, a non-parent, a non-subcontracted, just for free for service. And I would say, although doubling the number of social workers is credited, I would be interested in the ratio of the number of children they need to follow, and the impossibility, in my experience, that, you know, when I would move from school to school to see maybe 2 children here or 3 siblings here, I could have been housed in any one school at times 5. And so the idea is that it becomes an issue of understanding the truth of what the needs are and the reality of what the restraints from the resource standpoint is. So continue on. I think you'll like what you see. The other piece of why I feel like at this point in my career with HHP, I get to serve offenders as well as victims. Oftentimes victims are offenders and offenders are victims. I come from a long history of working with the victim side of violence. And so the beauty in that is that we can capture more individuals and the truth of who people really are. My sense is that we're going to need a lot more social workers. What I do at Temple when I work in collaboration with Ceasefire, as a licensed professional, I have ethics that I must abide by. And so there comes a point in my day sometimes where I have to figure out, do I have to file a report? And my style is to, if it is any one individual, they will know before the system knows that this is what I need to do according to my ethics. Individuals that do not have degrees, that are merited in their communities where they come from and they are neighbors to one another, have a different level of responsibility and freedom to move about delicate circumstances in a way that I need to involve other systems. So I think while you look at hopefully increasing your numbers of resource as it pertains to the needs of children. I did some outpatient work for RHD years ago, and we reduced the number of patients that myself and other clinicians were seeing that had primary caseloads of children, in part because there were so many involved systems with the children, much more than serving adults. So we had a different ratio. So when I think about social workers in a school setting and how many children they're following, and if you take the notion that that child comes from a family system that has all kinds of needs, you need a lot of time. And you need a lot of smart people not to overdiagnose or overreact or not be biased and take into consideration the truth of where this child comes from. So again, I think your efforts are needed and warranted, and I appreciate you doubling the numbers. And for all those social workers that went to work today and will go to work tomorrow, get more of them and get a lot more of them, because you're going to need them.
Can I add just one little thing? I'm sorry, even though I wasn't one of the people this was directed at. Joe Torre, who is a former Yankee manager and great baseball player, I met through Joel, Dr. Fine, and he was a co-chair of the Defending Childhood Children Exposure to Violence Task Force, Department of Justice effort. And he started a program in schools, and I think he called it Margaret's Place. The bottom line was he had been, and his mother was a major victim of domestic violence. His father was a police detective, and he also, of course, had some abuse. But he felt that it was really important to fund and support social workers in schools, and to have a sanctuary, a safe place in schools where kids knew they could go, they knew they were safe. And while his primary interest was domestic violence, so people could speak about that, it was also about bullying. So I actually went up and visited a school in Queens, and I thought it was really a powerful example of kind of the best of what you could do and try to reduce some of the trauma/stress, unhealthy stress that people feel.
Briefly, if I may, just to piggyback, I think there's also a role for community programs So to quickly answer your previous question, Councilman Johnson, it is Operation Peacemakers. And they've actually seen a 76% reduction in homicide in Richmond since 2009 when they instituted the program. They say it's not just a program, it's coupled with work they've been doing with policing and also focusing on just jobs in general in the region, but I did want to give you that information. Many of the leading trauma experts internationally who are also focused on human growth and actualizing human potential for healing and moving beyond incidents also credit work around narratives, art making, the body, ways that people can address two main things: the meaning that they've made out of their experiences that become the autobiographical narrative in their heads, that's then also promoting the stress response system sometime. Most kids are not going to go to therapy. If we're very honest, in my 10 years of working as part of that being my job, that it doesn't happen. The services are not in the neighborhood. The bus is a complication. There's so much happening. But there are programs and there are organizations who, if they were trained in very specific ways and partnered with a social worker or a therapist who was indeed trauma-informed and growth-centered, new things could happen. I think that's the beauty of where I work, the Village of Arts and Humanities. I spent 7 years at Freedom Theater, another space that did incredible work like that. They had, both organizations at one point, had social workers on staff. They had therapists on staff. They did not present them as such to the community or to the children because of stigma, but they were integrated into the fabric of that organization and were able to do some tremendous things. I think there's something to explore there in terms of cultural assets that are relevant, the whole nine, but I think there's a way that maybe partnership like Rob is talking about could be purposely invigorated in a new way.
Can I answer really? I'll be very quick. Very, very quick.
Yeah, madam.
Maybe not just social workers, but other people too. I think if you're going to look at funding, you can go beyond social workers, like a lactation specialist for the oldest child coming into the school where you know have 3 younger siblings, or any type of family therapist or an art therapist or any play therapist, somebody that can assist in creating that sanctuary and making it come to life beyond the child and supporting the oxygen that feeds the child, which is often those caretakers.
Dr. Fine?
I just had 2 comments to recognize and honor what you're saying. One is that we actually looked at it and just published research on the kids in our program, in violence intervention program at CHOP, who are assault injured, and 89% of the boys, predominantly African American boys, said that they would like mental health care. 89%, that's completely opposite of what we expected to hear. So it is not like they don't want it. It's just that it may not be accessible or they may not be getting there. We have to figure that out. But I think one of the things that we want to make sure we say when we're talking about throwing social workers and people out there to do trauma-informed care is those people, we need to spend some money on things that when they come back, they need to have something to go back to. Because the secondary trauma and the amount of effort it takes to be there really can affect a provider, and they're going to burn out. So the bees can be out there, but they need a hive to support them. And you know this, Mary Beth, from HHP, and Michael from your work, and everywhere that we work. There needs to be that support system, and that's oftentimes left out. The helpers, and we know this from the helpers in the community. There's always one person that a neighborhood is going to, right? That one guy or that one family that people go to when they have a problem. I remember it from our work in our violence center. And that person was getting burnt out. They weren't getting any support. So I really want to make sure that we honor that aspect of it before we lose it through the forest, through the trees.
Okay. Any other questions from the panel? Chairman O'Connell?
Thank you, Chairman. I just wanted to pick up on my colleague, my enforcement colleague, good friend, Rob, who I've known many years, on some aspects of what I've gotten out of what he said as well as what others said is that I think a key ingredient overall what I've heard today is the issue of trust, is trust and data sharing, information sharing. Of course, police officers, the majority of them are well-meaning and you know they have a mission, they do their job. But again, until that community can gain the trust of either that particular officer or that department, there's still going to be that divide, okay? That's why I've advocated more of a community liaison type of person who's non-enforcement but can communicate with each community. Each community, some words around here have been like silos. Neighborhoods are silos too, blocks are silos. I mean, what's happening in a few block area, people kind of know, and unless people can feel they can go to somebody that, can take their issue or can communicate what issues are going on in that particular, what I call a sector or a few block area, I think that they would, hopefully they can gain the respect of that person and trust and maybe address some of these problems in the front. I'm sure every council person would like to have a vast amount of community liaison people that they could be out there and they can know everything that's going on in the neighborhood on a on-time basis. But again, I'm hoping that some of the funding could be directed towards that effort. That's what I wanted just to respond. I think it's a big thing to do about trust, who to trust.
But and I would just respond that the trust has to be earned as well, and that it is great that there's a community relations officer, but it seems that any officer who's going into a community has to treat the people with respect.
Absolutely.
You can't just, I'm not saying you're saying this, but I'm just saying that too often, and I will say again, from my experiences in the communities in Philadelphia, when an officer is excellent, he will be praised or she will be praised because she is excellent.
Yeah.
But oftentimes it's one.
Yeah.
And there might be hundreds of officers who go through that city, that district every day, and they can't name other officers because officers don't stop. And I think that's the problem, that would enhance community policing 1,000 times. I know that there's lots of efforts, and the world today in Philadelphia Police Department is a million times better than it used to be, but it can still improve a lot.
Absolutely.
Any other questions from members of the panel? Okay, thank you very much for your testimony. So now we're going to open it up for public testimony before we wrap up. That's the formal panels that are taking place. It's the public comment section. Okay.
Judith Robinson.
Read all of them. That's it.
Good afternoon.
Good afternoon, Ms. Robinson. Can you just state your first and last name for the record, please?
Yes, my name is Judith Robinson, and I'm here to testify on bill number 170609, resolution. I want to say deja vu because it seems like I've been hearing some of these same things many times in the past. I go back, unfortunately, to over a decade ago. There was a blueprint for a safer Philadelphia, supposedly. I was very engaged. I went out and purchased Dr. Deborah Proutro-Stitt's book, Murder is No Accident. Deadly Consequences was another one of her books. And I really thought that we as a community were going to really wrap our arms around this issue that so definitely, so deadly affects the African American community, our young African American males. But here we are, over a decade later, with some of the same issues, and I'm hearing some of the same solutions. So what's taking us so long? What's the problem? Dr. Deborah Stitt was a doctor of public health. She wanted to approach the issue regarding it as public health from Boston. Spelman grad, Harvard University, all that, okay? And I got really a lot of insight as to the various areas, the courts, the DA's office, all these areas where money is spent. So here we are, millions of dollars later, sadly, thousands of dead young men, and we're still talking about things that should be done, that could be done, that we wish we could do. And it's really sad to listen to solutions that we know can help us, and they not be implemented. Everything but. Prevention, we know, is the key. We know that. Rites of passage, history, cultural competency, education, all of that, jobs, economics, development, all that. The environment we're in. Yeah, Mr. Reed, I was one of those people from Strawberry Mansion Civic Association, who was skeptical. I'm skeptical now because of what I keep hearing. Over a decade ago, Fahim Child's name was put in the legislation at the state level to get that money. And that was a shoot up in our school, a child trying to get to school in the morning. Okay, I really thought we had our arms wrapped around this. We got murder, we got outrage, then we get quiet. Murder, outrage, then we get quiet. I want you all to attack this like you do when white people want something attacked, okay? I'm gonna say it like that, real like that. Because we went through hell with crack, now with opioids, it's this focus. Well, you know, at what point are we, I'm gonna say we're in the African American community, gonna demand not that we get a contract, but that we deal with prevention. Because sometimes you might not get the contract because you're not doing that work. So we need to start following the dollars and all of that. So I'm not going to reiterate every good thing that I've heard today, except to focus in, because I'm in the 22nd district, where we have double the rate of murders. When I saw that, and I said, wow. We have the president of city council. I want you all to help him deal with that issue because it doesn't make sense. It doesn't match up, you know, power and demand and all that. So I'm not going to delve too deep into all of that, except that I would like to request that we deal with this as a health issue, mental health, public health, very much health issue, and that we do it now, that we not keep going at this again with different professionals. We have all the professionals, we know the studies. Tracing the guns. I want to know, how in the hell does a child get a gun? Everybody got 99 excuses for me. I'm a committee person. I went into the ward meeting and I asked the committee people, how does this happen, you all? It was that day we were getting a couple dollars they didn't want to hear. You know, it's like they 99 excuses. I don't want to hear any excuses. I want to know how, who, what, when. Just like the prostitutes and the John's names are published in the newspaper, I would like to have published in the newspaper, weekly, monthly, you know, give it a little time to get the details, where are those guns coming from? Now, I hear about the serial number being scratched off. I understand they can put it back on with some technology. I understand that some girlfriends and mothers and sisters, and they want to try to say some black women are giving up guns to criminals, and they're shooting up our neighborhood. The way crime is happening in our neighborhood, you don't know who the heck is doing it because no suspect, no arrest. So I want to know whoever it is, whatever's happening, let's publish that information. Can we get tracing of guns? It's illegal already. I don't want to hear about any other law that needs to be passed because 18 years old should not have a gun in Philadelphia, Pennsylvania.
Period.
That's already on the books.
Period.
So why aren't we finding that out? That's making that like an emergency in my neighborhood, the 22nd district. Use us as a little test case. Tell us where them guns coming from that's getting in the hands of little Raheem, 12 years old, 13 years old, shooting out all over the place. Then the last thing I want some help with is, I heard about this, I was trying to figure out, like, how do you connect gun violence and then bioethics? What's going on there? What's that all about? Then I heard about a trauma study in these trauma hospitals. They have to have gunshot wounds in order to do their study. Now, I'm not law enforcement, I'm not health, I'm grandmother from North Philly, okay? And I'm just asking
Yes, ma'am.
how we could deal with this issue in a way, ASAP, that will reduce the amount of murders in my neighborhood, like it's an emergency. Like it's an emergency. 22nd District, everybody knows it, west of Broad, the worst of everything, as it relates to all of these things we talked about today.
Yes.
What's the approach? What's the next move for this committee? What's the next move for you, elected officials? What's the next move? And I'm going to close right there. Thank you.
Thank you. Thank you very much, Ms. Robinson. Any questions from members of the panel? Ms. Robinson?
Yes.
But just in general, in terms of what we're doing, half of this is information gathering, but the other component that we always were working on, probably behind the scenes, that a lot of people do not see. At least I know in my district, we consistently work with the homicide detectives, we consistently work with the inspector, but we also work with other individuals who are on the ground, trying to work with some of the young men who are carrying the guns, but separate from information gathering and try to figure out how we address this from a crisis standpoint, like immediately now, we're going to continue to work on it. So I just wanted to say that for the record.
I appreciate that. We just got a new Powell Center in Strawberry Mansion.
Sure did.
Every little bit helps, but please help me with them guns in
Yes,
them
ma'am.
hands of children, criminals, mentally disturbed, anybody who
ma'am.
should not have them.
I agree.
That's where I would like to find.
And I will also ask to continue to put the pressure on, because this is a collaboration effort with those who work with us on the state level, because oftentimes when we want to try to change policy as it relates to guns in the city of Philadelphia, we are somewhat limited with our hands tied behind our back, because mostly legislators on the state level are the ones who can actually dictate policy that has an impact on if you can or can't carry a gun. But the reality is there are some things we're looking at on a local level. Like, for instance, my co-chair, Darrell O'Connor, talked about, like, in the city of Philadelphia, we should have a gun offender database that pops up, you've been arrested for a gun, that work with the Philadelphia Police Department, so they can kind of know who are the key shooters in the neighborhood, and as a way to track those who are carrying guns. And so we're going to look at doing some things differently. I remember the blueprint for Saving Philadelphia, yet it was under the leadership of Dwight Evans at that particular time. I'm serious about the work that I'm doing though, with this committee, because there's a variety of other things that we could be doing right now, and so we're going to try to figure out a way to we're going to figure out a way to do some things differently, and that's my commitment to this process. So
Thank you for your time.
No, thank you. Can you please, clerk, please call the next witness?
Mr. Chairman, there are no other names.
Not his name? No. State your name.
Maj Toure, M-A-J-T-O-U-R-E.
How you doing, Maj?
I'm good. How are y'all? Just real quick, I found out about the, one, thank y'all for doing this. A lot of times, first and foremost, I have an organization called Black Guns Matter. We are a firearms safety organization. Our primary objective, right now we're on a 50-state tour, completely funded by people from urban areas across the nation. What we do is we go into areas that are high crime, high violence, high murder, the scary places like North Philly, well, maybe not so much now.
It's not scary in
it's
North
not
Philly.
Yeah, not as much as
It's gun violence, it's not scary.
Right. So, Chicago, Atlanta, New Orleans, places like that have extremely high per capita, homicides, in the cities. We've seen a tremendous impact by dealing with prevention, conflict resolution, and de-escalation tactics. I mean, that's not as cool of a soundbite as the shooting and the teddy bear vigil and all of that to a lot of people, but it's a lot more preventative maintenance. We have been operating and working with anyone. I've worked with, had meetings with Shara Goodman from Ceasefire. We work at the gun ranges. We link up with guys and women and letting them know this is the lawful process, this is the unlawful process. This will send you to prison, this will get you killed probably, and this will not. We work a very thin line and a balance between, again, conflict resolution and informing people before they make the mistake what that mistake could actually cost them. So really, I'm just here to make myself available to anybody that would like to do some of that work. All of my, pro-gun friends told me when I found out about this today on Facebook, don't go there, they're not going to listen to you.
No, that's cool.
You know what I'm
got
saying?
the letter from the council president.
Yeah, right.
Yeah, good shout out to him on
You know what I'm
Facebook.
saying?
Thank you.
Thank you. So it's like, to me, that approach of, they don't listen to us, we don't listen to them, has not been working. Adding more of those laws, if that was the case, if they work, Chicago would be the safest place on earth. It's not. So what we found success with, any questions y'all have, I'll real quickly answer them. We found success with, especially younger guys, getting them to understand exactly what this firearm does. It is not Call of Duty. This is not a video game. And this is what happens when you treat it as such. The prison ramifications, your family ramifications, and things of that, those have been excellent tools. We actually worked for a weekend. Yes, Philly taught firearm safety, prevention to children in Yes, Philly schools. We did this, June, for a week. All of those students have graduated. So I'm saying these things to say, what we're doing is working. We got to GoFundMe. People have been helping all across the nation. The problem's the same. The solutions aren't working, and we got to kind of like refine the approach. So if y'all have any questions, I got a few answers, if so.
I have a quick question.
Sure.
Because now I remember meeting you outside when we did the prayer for a city some time ago. So here's what I want to understand. Talk about the de-escalation, right? Because I respect the work that you're doing in terms of showing people how to legally carry a firearm, how to operate a firearm. And to me, that's kind of similar to how I went to Mansfield University, and some of my roommates, some of my classmates, they were experts in, like at Mansfield, upstate Pennsylvania, you can bring your gun to campus. You can lock up your gun inside the security, inside campus security, right? Because guns are a way of life. In Western Pennsylvania, right? So I get that part. And I'm saying this, and I'm just keep it real, what I want you to help me understand. How do you, I know you talked about teaching these young people, this is not Call of Duty, this can get you locked up. How do you approach the young person at the allure of that gun in the street life? Like, they just heard in a rap song that you got a 29, and you got a clip with 30 rounds in it, and you just shot up the whole neighborhood, and they like that they heard that in the song, and they can't separate that this is entertainment versus this is the reality. And the guy that carried the biggest gun in the street has the best reputation because he got the nice gun and he's willing to shoot at somebody. Kind of, how would you approach that?
Well,
because you're talking about legally carrying guns, and we're talking about those who just really, be honest with you, they carry guns, they buy guns off the street because one neighborhood going through something with another neighborhood.
Well,
so how would you approach that?
It's kind of like the word that one of the speakers before presented was tertiary, working in, in triples. One, the prevention. Okay, if this person is past the prevention, if we get into the guys that are caught up in the allure, one, we do a good job of informing them. It's like your children. My daughter, I don't, but if I leave a firearm around, my daughter knows specifically, Dad, what are you doing? That's not right. The information is very similar. The application of the information is very similar. You destroy the allure by informing the person. By what we're doing is we're making the actual tool taboo, totally removing
Gotcha.
the information process from
Okay.
it. So, for example, if someone says, like you said, okay, every rap artist says clip, that is technically incorrect.
Okay.
And you look stupid going into a gun store using the word clip. That is not what a clip is. It's a magazine. Then informing that person, and they see how many things that they don't know. When they say, oh, this is my 9. Okay, well, that's the caliber of a firearm. What brand, what make or model is this? And they see how much they don't know. There are a lot more, in our experience, we've been doing it for about 1.5 years now. In our experience, by informing the person, removing the taboo, and the third part, taking them on the range to see what this actual firearm does. Television says a silencer is going to make it sound like birds chirping. It does not. It just suppresses some of the sound. When you hear that 9 or that 40 caliber with ear protection on and it's still loud, you see that, okay, this might even be a louder situation in a real setting. The information and presenting it in a safe, controlled environment lawfully removes the taboo in most of the scenarios.
I'm going to wrap up on one last part where I feel where you're coming from now. So there was a story in the Philadelphia Daily News. I don't know if everyone had a chance to read it. And Rob Reed, he just left because Rob had an interaction with a young man that the ATF actually had working for them to help get guns off the street.
Right.
And I think Ms. Bellamy over there probably know the young man because he was ceasefire by day, by night, living the street life, right? But it talked about his childhood, right? How this guy grew up. Dad was in the gang, he grew up in the gang, but it talked about when he was a kid, his dad had a gun underneath the mattress.
Yeah.
And he would go in the room and touch the gun, and then lower the gun, kind of, you know, the whole, like, wow. And at the time when he grew of age, and that street life began.
That person had an improper knowledge of firearm safety. His father had an improper knowledge of firearm safety. What we do in our classes, one, we've worked with ceasefire, we work with other safety, firearm locks, and that's just the basics. Teaching people how to biometric safe. Putting a firearm under your mattress is the silliest thing you could ever do in your life. But that's misinformation. And showing somebody, that's the reason why most of our children that are shot are because they're shooting themselves in the face because they're grabbing this firearm because the parent did not know how to, secure that firearm properly, and they're using their thumbs and shooting themselves. That's misinformation. That is clear-cut misinformation. It takes 5 pounds of pressure for the average trigger to even be pulled. So by giving people more information and teaching those parents, some of the guys that come to our classes, I know you in the street. I know you're in the street. You're not going to touch the firearm portion of our class. However, you are going to bring your lady, you're going to bring your son, you're going to inform them how to safely, and we're going to show you how to, you're going to do it. But what you are also going to do is you're going to safely secure that firearm. Okay. That information, when you take it away, take the taboo or the allure away, it's your cell phone now. Don't touch dad's cell phone. Okay. So by hiding it, we have sex education classes. We did. I don't know still now. But we have these classes. There's insurance and information for your cell phone. Okay. But the way that we're handling firearms in this way, it has not been working because we're hiding it. And, that's in our experience.
So we're probably going to do a follow-up, right? Just so you can continue. Let me just keep it real with you, right? You got to show me the process. I guess I'm just trying to connect the work that I do with people who legally carry firearms and the elements of what I just see in South Philly, where I grew up at, especially with this war that's going on right now. These guys doing videos, right, with like all kinds of guns. They call diss videos, right? Yeah. I'm going to diss you, and I'm going to put it in it's kind of like the dumbest thing that you can do because you're showing the law enforcement, like,
that's me going to prison.
Everybody got 10, 20 real guns in them, right? Talking about what I'm going to do with you when I see you. So I'm just trying to wrap my head around.
Most of those guys have never shot a firearm in their life.
Okay.
Most of those guys are ill-informed. And those are the guys that's where our outreach comes in at. Before, outside of the range, you're not touching a firearm. So I make myself available, our organization available to everybody. Thank y'all for even listening.
No, of course, thank you.
Yeah. All right, peace.
Any other comments for this committee before we wrap up? Because we have to. You have to go to the microphone and state your name for the record.
Okay.
And then we'll be wrapping up.
How you doing? My name is Carl Day. I'm a pastor, community leader.
What church?
Culture Changing Christians, non-denominational church. I do work here in Philadelphia. We got a campus here in Philly. Also in North Jersey, Essex County. Also do work in New York. So I'm kind of all over the place, but I reside and rest my head in Philly. Grew up in North Philly. Very quickly, at one point in my life, I fell victim to these streets myself. About 2009. Finally, things caught up to me. Found myself in the jail, both for violent crimes. So I know all about gun culture. Carried guns. Been arrested for guns.
Yes.
And I've devoted my life. Thank God I've had great people in my life that help steer me through faith and everything else to do the work that I do. And one of the things in which I've been hearing a lot about, and one of our organization is all about changing the culture. And I hear people talk about street culture.
Yeah.
And I think, while there definitely is a medical related issues, trauma and everything else is real. But at the same time, we have to also change what really influences culture. And I don't hear enough of I don't hear enough of things being talked about as far as what's influencing our people. Because like you said, sir, we can offer jobs, but the allure and the aura that comes with operating and dealing with the street culture and street life, folks don't care about jobs. I sit on street corners. I've ran initiatives, Men on the Move. We've been in every hood of the city from August to October. We literally walked street corners. I've mobilized men, and we talk to the men. And literally, it's not about a job. There's 10 guys on the block. They all sell the same product. The market is oversaturated. There's no money being made. The prices of drugs, they're crying about what they're paying for drugs. So the profit's not even great anymore. So it's not about money for them. It's more so the lust and the allure of what goes on in the community. And those are the people who are relevant in the community. So we have to also deal with, the idols of our culture. And I think also, we have to hold the city accountable to a degree, because we talk about having credible messengers. We have to make sure these same brothers that we consider to be credible are really being credible in the communities. You know what I'm saying? Like, I'm not here to name drop or anything, but I know what goes on. So everybody that comes home and says that they got good intentions aren't necessarily walking the straight and narrow either. So it sends mixed signals to the city. So those people in those communities may know that God, know him for a particular thing, but at the same time still knows he may be the guy that also may be still making connections behind the scenes for them. So it's also, and also as a city, we have to be consistent, because just like you said about the rap songs, I've been recently at a vigil where a guy that was well known in the city got killed, spoke there, and literally they're still celebrating, listening to the same music that's talking about running down and shooting people, and we're literally here to mourn and celebrate a man's life. So as a city, we have to be consistent, because we'll see also city officials and whatnot supporting these same hip hop artists that influence our youth with the same music. So, they can't sit here and want to say, we'll give back, or we're going to do this, and we're going to come speak to you at your school and say, hey, go to school, stay in school, but your platform of influence is through your art. So if you're in your art, if you're in your music, and you're instructing our youth to continue to carry those pistols, to be about the murder game, it doesn't matter what you're saying in an interview later, because that's not really impacting them. Your influence is right there in the music. Sort of like Kaepernick using his influence on the field, because that's where people watch him. They don't care to watch him off the field. He kneeled for a purpose, which caused the public stir. So we need it to be consistent. And I think that imagery is everything, because these youths are really impressed by what they see. And it's just very important that we have to be consistent about the visuals that we're setting before them, how we're changing the imagery of what it looks like to be a black young male, millennial male in the urban inner city minority settings. And just like Brother Shondell said as well, and that goes into supporting a lot of the people that's on the ground as well, that aren't well known, that maybe not be, not out there to the masses, but really doing great work, because oftentimes we see those people burn out because of the lack of support. They don't have the big name. They're not tied to the big name people. They're not networked with everybody else. So we have to definitely support them. But I definitely understand trauma, mental health, and everything else, and that is essential for what's going on. But at the same time, how do you connect that to them to make it appear cool? Because it's tough. It's tough. Harriet Tubman said it. She could have freed more slaves if other people would have realized they were slaves. So we're talking about people going through trauma. You have to convince them that they're in a position or in a state of trauma. Most times people tell you, I'm fine. This is everyday life. Somebody got killed, so what? That's what happens. They're not saying, oh my God, they're saying, let me make sure that's not a friend of mine. Okay, that was nobody, and they just keep it moving. So these are just experiences I've seen, and I do work in New York City, Newark, New Jersey, East Orange, also in Philadelphia, and I'm from North Philly. And like I said, I've been through it myself, so I just wanted to go ahead and state that.
No, thank you very much for the insight. And any questions? Okay, this meeting shall stand in recess to the call of the chair, and I'd like to thank everyone for coming. Come on. 1 second, one last comment.
Good afternoon.
I know you are, but just state your name for the record.
I'm Isaac Gardner, head of Justice for David Jones Coalition here in the city of Philadelphia.
Yes, sir.
I just want to say I came today just to hear, because I just wanted some feedback to take back to my community.
Yes.
And it was very informative of a lot of things I heard here today. I just want to say a couple of things as far as, I think what we need to start doing is that getting in touch with the families, after the crime, after the gun violence, that we need, to have that connection with the family, that don't just be there, for the funeral, for the services, then we out their life, because they still have pain that they carry on, once their loved one is gone. So I think that's a big thing that we need to know. We need some type of, I know she do a great, excellent job of what she's doing. She's excellent at what she does. Trust me. If it was 1,000 more people like her, I would feel better. Everybody would feel good. But at the end of the day, we have to know, it's not just our loved one is gone. So what's the next step? Yeah. If the offender is still on the streets, that's another big problem, because that family doesn't feel safe. You understand what I mean? So we just can't leave them out there and saying, the investigation is still going on. We got to keep these families and let them know that we got people that still care about them, still love them, and we still doing things to make sure if the offender's not caught, he will get caught. Because me, personally, I come from the streets. I know what it's about. You see me out there. I've been a victim of gun violence. I was an offender of gun violence. So I know how it goes both ways. So I'm here today just to say, I appreciate y'all letting me come in and hear what's going on. And we still got work to do, and that's what I'm here for.
Thank you.
So y'all have a good day.
Thank you for that insight. Thank everyone for being here today. I also want to acknowledge Marla Davis Bellamy. I said that correctly? Operation Ceasefire, 22nd Police District. I know you've been on this case working for a long time. And Ms. Caroline McGlynn on the Focus Deterrent Program. These are two programs that were mentioned earlier today, and we will continue to be supportive of your efforts to try to figure out how we address this issue of youth gun violence. So thank you for being on the case. Thank everyone for being here today, and this committee shall stand in recess to the call of the chair.